here, and then just give me a moment so I can start the recording. All righty, Madam Chair, we're ready to go.
All righty. Good afternoon, everybody. We're on to General Government B right now. And first up, we have the Secretary of the Office of Policy and Management. Thank you very much, Madam Secretary, for joining us. As you know, we're trying to do something different this year. So we're going to go right into questions after you have an opportunity to introduce your team.
Great. Good afternoon, Senator Austin, Representative Walker, Senator Lesser, Representative Baker, Senator Minor, Representative Belinsky, and the members of the Appropriations Committee. Pleasure to be here with you today. We will make our intro very brief. I do want to recognize key members of my team. I'm joined today by Deputy Secretary Diamantis, as well as our undersecretaries and division directors and very knowledgeable individuals throughout the OPM team to properly attend to your questions. With that, I will turn it back over to you, Madam Chairs, and I'm happy to take any questions that the committee has at the time. Thank you.
Thank you very much, Madam Secretary. And I remind everybody to put your hands up in case you have any questions. And what we've been asking everybody is about the staffing. And I don't need it right now, but if you could send me a list of staffing relative to, in comparison to last year to this year. I think you had an increase based on the changes that happened in school construction, probably a decrease and an increase. So if we could have what it was and what it is and how it got there, the ups and downs, that would be great. And then relative to any of the federal dollars that came in, just a summary of the federal dollars that came in relative to where they went. And that would be my two questions. And thank you. I don't need you to say it now because that would take all the time just talking about the federal dollars. And I want other people to get an opportunity to ask their questions. So the next is Representative Walker.
Thank you, Madam Chair. And I'm just going to piggyback off your question. So this is one of my, but when we talk about the federal dollars, could we get the breakdown of the COVID dollars, which ones have been paid and which haven't been? Because we had asked for it and we were looking for it for today's meeting. So hopefully we could get that as soon as possible. And when I say that, I mean, let's say you gave Tony Walker 100,000, but on paper, but you only didn't.
How much was actually distributed? Sure. We have a comprehensive report coming to you to the Appropriations Committee. It will include a focus on CRF by category, what's been allocated, whether it's housing, testing, nonprofits. And I'm seeing from some of the conversations with other agencies looking for clarity by agency.
Yes.
And then beyond CRF, there are all the other host of stimulus dollars that were provided. And so we'll give you a full report. I think when you asked for it in response to my first presentation, and where there are a number of questions, we'll get the whole package over to you.
Awesome.
All right.
Awesome.
Great.
You made my day on that one. And on the staffing, I know, and we've been going through the agencies, and it would help us to understand how many people. I know it says 43 on your sheets, but I think it would be good to know how many are going into labor relations. I see Faye on the call, labor relations, and then how many are going into human resources going into you, or is it going into DAS?
Going into DAS. So the major changes, and we'll give you a full breakdown of our changes in our position count. It's a little over 50 positions that are being consolidated, centralized from agencies and going into the labor relations function. And then the remainder of the positions are going into DAS. There are no positions being transferred for school construction. The only other adjustments are related to broadband, cannabis, and within criminal justice.
Okay.
So those are the most significant.
I'm sorry. So the broadband isn't that going to DAS?
Broadband, or were you asking HR? Broadband. Let's deal with broadband. Broadband has 4 key components. There's about $2.9 million that's reflected in the governor's recommendations to you. First, OPM would play the role within our data and policy analytics unit, would play a role in helping to achieve the mapping. We do not have GIS mapping throughout the state to understand where the gaps are, where we have the services, what are the speeds that are available throughout the communities in the state. So that's OPM's piece. Within DEEP, that's the second agency, within their Office of Telecom and Broadband, that would be established within their Bureau of Energy and Technology. DEEP would play the role of establishing the connectivity speed standards. What speed is necessary to indicate or certify you have universal service, right? They would be appearing before PURA as a representative in their proceedings. Then within the Office of Consumer Counsel, the existing Office of State Broadband would be expanded so they can represent all of the consumers' complaints and partner with DEEP and OPM on establishing the standards in this new framework. And then PURA would be stood up with staffing to address a new jurisdiction. They'd now be responsible for broadband. So there are 4 agencies that have a piece of the broadband puzzle,
Okay.
and DAS is not a part of that.
Okay, and you don't have to give me, but then the breakdown for your criminal justice, if we get that too. So
Absolutely.
Thank you, ma'am.
You're
Thank
welcome.
you. Thank you,
Good to see
Madam Chair.
Thank you very much, Representative Walker. Representative Gilchrist, followed by Representative Belinsky.
Thank you, Madam Chair. Good to see you, Secretary McCaw.
Good to see you.
My questions have to do with Project Longevity. I'd like to know the thinking behind the cut that is planned in the second year of the budget to Project Longevity, considering there's been an increase in gun violence in our cities. And I believe there's plans to expand the program to an additional 4th city of Waterbury.
So first of all, thank you for the question. And the governor does remain committed to Project Longevity to support reducing crime throughout our cities and heavily in our urban centers. Just by way of some of the background on this program, you might be aware that going all the way back to 2017 and 18, this program was funded around $850,000. Then we had some financial challenges in the state. We cut the program to about $550,000. And so actual spend in 2019 was a little over $550,000. In the current biennium, the appropriation was increased to just under $1 million, about $998,000. And the intent of the legislature was to expand to include Waterbury. At that time, Waterbury was very focused on their Project Safe Neighborhoods, a slightly different model. And so every location, Hartford, New Haven, and Bridgeport, all received a substantial increase in their funding. Back in 2019, they were all getting $142K. They're now receiving anywhere from $180,000 to $200,000. So we bumped up funding in each of those areas. Waterbury at the time was not interested or not ready to take advantage of the new funding. The $50,000 adjustment is reflective of a holdback, a 5% holdback. Those dollars have never been released. So therefore, we can sustain the program, fund Waterbury, and not reduce the level of funding that has been given to any of the districts. So bottom line is, from an appropriation perspective, it looks like a cut. Those are dollars that never went out the door. We've also been able to supplement funding from other sources. We have the $125,000 of stimulus funds that were invested into Project Longevity. We have some additional dollars available that could help supplement. We have the $100,000 of additional funding for the Every Town for Gun Safety grant funding we received, as well as an IKEA Foundation grant. So we are trying to get funds not just from the state budget, but from the federal and other philanthropic providers. We think those resources allow us to sustain the program and expand to Waterbury. So for that reason, there's a reduction of $50,000 in the budget. Obviously, if we can continue to provide any other support through the Coronavirus Relief Fund, we will do that as well.
That's really good to hear that the department is committed to investing more in that work. I appreciate that. Thank you for that answer. As you're probably aware, Project Longevity uses a group violence intervention. When it comes to evidence-based gun violence prevention, there are a few additional intervention methods, hospital-based violence intervention, violence interrupters. And so I'd love to see our state expand this work. Would your Office of Criminal Justice Policy and Planning be open to taking on more of these evidence-based interventions in addition to Project Longevity?
Well, you might recall that as a part of this Project Longevity budget, there's a statewide coordinating function. And so there's actually a coordinator. And so embedded in these funds are resources that could help us evaluate whether there are other tools we want to use, such as the ones that you commented on. We would certainly be happy to have further discussions about other tools that might make the program more successful, other evidence-based practices. So, certainly Undersecretary Mark Pelka would be happy to engage with you in bringing some of those ideas to the forefront of this planning group. And we use that statewide coordinator to work with the existing sites, Hartford, Waterbury, Hartford, Bridgeport, and New Haven, and bring ideas of the evidence-based practices. So that's precisely the model, using the statewide coordinator to facilitate a new way of thinking, to be more effective with our young people in our community. So would love for you to connect with Undersecretary Pelka, and he would certainly support, and I would support some of the ideas you're talking about as well.
Thank you so much. I really appreciate your responses, and I look forward to working together.
Thank you.
Madam Chair.
Okay, because we have so many people that want to ask questions and our questions are short, I'm going to weave in the chairs of the subcommittee, Senator Lesser, followed by Representative Belinsky, followed by Representative Baker.
Thank you, Madam Chair, and thank you, Madam Secretary. It's good to see you. Just had a few questions about some of the provisions of this budget, but that are not directly related to OPM. But specifically the RSA line item. Are you assuming that there will be any contracts completed in the biennium in that? Or are you also assuming CBAC renegotiation as part of the budget?
Good to see you, Senator, and thank you for the question. With respect to CBAC, we are not assuming any CBAC negotiations. The terms of that agreement don't expire until 2027, and we are not approached the union, nor are we expressed a desire to reopen CBAC. With respect to the assumptions in RSA, obviously we have anticipated retirements that will be forthcoming as we get closer to July 2022. We could see a major uptick in vacation and sick leave accrual payouts. We are not holding funds for the for any wage increases, COLAs. We have budgeted for the annual increment, which is based on your service anniversary if you're not at max. And we have held in the first year of the budget a COLA increase for non-union. They did not receive an increase last year or the current year. We are seeing a continued trend towards unionization, and they're a little bit behind the 8 ball with salaries, where their employees make more than the supervisors. We have to begin to address some of those issues. So that's essentially what RSA is currently reflecting in the governor's proposed.
Thank you for that answer, Madam Secretary. And through you, Madam Chair, just a couple other places where there are savings listed in the budget. There's a change from current statute in how the state uses bond premium dollars. And then there's also delayed reamortization of SERS. And was curious in the first instance if you received the support of the Treasurer's Office, if you engaged with him at all on that proposal, and if you had any more comments about the potential long-term impact of the delayed amortization.
Sure. Through you, Madam Chairs. So first of all, with respect to bond premium, current law provides that starting in fiscal 22, we would not use bond premium to cover principal and interest costs. It had an expense of $20 million in the first year and $70 million in the second year. We have a $4 billion deficit. We are doing a fantastic job maintaining investments in bond funds within about 1.6 billion of issuance. The Treasurer's Office is aware of that. They're aware that there's almost a potentially in the future gives us more capacity for bonding or to issue less. I think the treasurer supports the current law, which would create a larger deficit for the state, but would like to see those dollars reinvested. That is a matter of how we're going to balance this budget. And so for that reason, the governor's position is if we have adequate amount of bonding and we can issue $1.6 billion and we can make the proper investments in the bond commission, why do we need to now divert bond premium, driving up the cost in the general fund? So the treasurer knows where the governor's office and where I stand on it, and he has a slightly different position.
Thank you. And if there is a relief payment from the federal government that we receive in the near term, are there adjustments that you would suggest that we take into account? I assume that you're not assuming additional federal relief that we haven't yet received, but if we do get some, what would you suggest how should we think about potential federal relief payments?
If I could just interrupt for 1 second, because we only have another 13 minutes with the secretary. If you have any questions that you're asking that the answers could come to the working group, that would be much appreciated.
Right. And Madam Chair, that's my last question. I want to be respectful.
Thank you.
All right, I'm going to answer it as quickly as possible to stretch the time. As we've seen in the latest version of the bill in Washington, approximately $2.6 billion could come to state government, which could include revenue replacement. The budget as proposed by the governor assumes $1.7 billion of that funding for helping to balance our budget, still leaving with us just under $1 billion for other needs. My recommendation would be as follows. There are certain things for COVID success we still need to fund. Our testing program. Are there any gaps in vaccine cost, PPE, quarantine outbreaks, things of that nature that are not reflected in the governor's budget? We will have to pay for those types of expenses. And then from there, we can begin to think about, are there areas of investment that we put funds in this year that we want to continue? One area could be nonprofit providers to continue to provide them with support. I'd like to continue that dialogue with the Appropriations Committee as we get more clarity from the feds as to when the dollars are coming, if they are, and how much. But keep in the back of your mind that all of our response measures that achieved these successful results for COVID, they were primarily funded from CRF. We're going to need to keep some of that going. And then there'll be some funding, there'll be capacity for discretionary funding. Over to you, Senator Austin.
Thank you very much.
2 minutes, ma'am.
I know. Representative Valinsky, followed by Representative Baker, followed by Senator Minor.
Thank you, Madam Chair, and thank you, Madam Secretary. There is a very, very big time crunch, so I have a bunch of questions. I'm going to limit myself to 3 topics, but they're going to require the comeback of information, so dialogue can be minimal. We're looking at pilot, and there are some pilot underfunding issues that are that are visible to everybody. I'm wondering if we were to instead of filling holes with pilot, if we were to fully fund pilot, what would the impact of that be, and can it result in more equity and adherence to a formula as on a go forward basis versus just tackling problem by problem. That would be one question. Another question I've got is with the legalization of recreational cannabis. I'm seeing budget lines in multiple agencies for the regulatory, the enforcement, a little bit of administration in your budget. I'd like to see a complete aggregating of that information so that we can really take a look at everything and in every functional area that's going to be invested in that, and just sort of weigh it against the budgetary expectations, just so that there's no surprises going forward. And then of course Senator Lesser began to ask about the wage and compensation, and you started to address the retirements. Again, every single agency has, current service provide funding for wage and comp related increases in it. I'd like to look at that in an aggregated way as well. And then, just share thoughts about what it's going to mean as far as the retirement, and the application of sick time and all that other stuff that you were talking about before, knowing that it's going to change going forward. So the need for, continuing conversation is there and very, very much welcome. That's really all I have this, the budget from your perspective. The only time I ever rose out of my chair during a budget address, in this being my ninth budget address, was when Governor Lamont said that Connecticut doesn't need more taxes, it needs more taxpayers. So I like that theme, and I would love to support everything we can do to make that happen.
Well, Madam Secretary, if you could bring all that information to the working
Absolutely.
group, that would be wonderful.
Sure.
Are you all set, Representative?
I am totally set. Thank you, Madam Chair.
Thank you, Representative Baker. And Senator Minor said he would hold his questions to the end. Will be followed by Representative Zawistowski after Representative Baker.
Good afternoon, Madam Secretary. The last time you were before this committee, you talked a little bit about the disparity study in which your department was going to be doing with it. Can you please give us some feedback on where we're moving in terms of with this study in the future, and how your department is going to be handling and that's all I have at this particular time, Madam Chair.
Thank you. Senator Austin, would you like me to address that now or through the subcommittee?
I think Representative Baker, would you like that answered now, or can we handle that
I
at the
mean,
subcommittee?
if she wants to answer, that's fine. And I was trying to be considerate of time.
Let me give you
Okay.
a quick 30-second snippet. Last year, we proposed to carry forward funding to fund that study. It would be conducted by DAS. DECD would play a role as well. As we know, we didn't have a budget. We, due to COVID, what I would propose is that we also do the same. We need to resource it. And through the final negotiations of the budget, we identify an area that has some extra dollars to do so. So we lost time with not having the passage of a budget, still on a priority for the administration. And so we can talk about it more at subcommittee, and OPM will identify a carry forward from 21 to 22 to help to cover the cost. So more to come on that, Representative Baker. Still very much a commitment to completing the work.
So real quick, so will I be able to see the dollars in the DAS budget?
When we
Where would I see
finalize this budget, we need to identify an account that will have extra dollars this year to carry it forward. It's still a little early right now. We just went from deficit to surplus.
Okay.
So I think in the next month, we'll identify where, and we'll certainly support that in your partnership with you. Okay.
All right. Thank you.
Good to see you, sir.
Thank you.
Representative Zawistowski, followed by Representative Datham, and if we have time, Senator Minor.
Thank you, Madam Chair. I'm going to hold one of my two questions for the working group. Madam Secretary, under the policy revisions section, you had a reduction in funding for the Connecticut Municipal Redevelopment Authority. It's something that I don't disagree with, but this is a relatively new quasi. Where can I find the actual funding, if any, that they are getting from the general fund at this point?
Thank you, Representative Zawistowski. Very quickly, MRDA, Municipal Redevelopment Authority, it has not yet been stood up. Originally, the thought was to leverage CRDA. They've done a great job with some of the redevelopment, economic development plans. They did not feel they currently have the capacity, and so we have delayed the timeframe to stand up the authority to July 1, 2022. The dollars have been sitting there, appropriated $500,000, and are lapsing. So we've adjusted the funding to $100,000. That's what we think we'll need to begin to staff the authority. And that's the reason you're seeing a reduction. We'll certainly bring more information to you to the subcommittee and be available to answer any other questions you might have.
Okay, do appreciate that. Are there any other quasis that are funded by the general fund in the budget?
Happy to bring more information for you. CRDA is the Excel Center, Rentschler Field Convention Center is certainly another one. We have the Port Authority that has a line item within the Special Transportation Fund within DOT. Those are two that come to mind. We'll bring a comprehensive report to you to the subcommittee.
Great, that would be extremely helpful. Thank you very much, Madam Secretary, and thanks, Madam Chair.
Thank you very much, Representative. Representative Datham.
Great. Thank you, Madam Chair. And thank you, Madam Secretary, for your presentation and all your work on this budget. Just wanted to ask if you all have done a write-up and an analysis of the transfer of the labor relations functions to OPM. I'd love to get an understanding on the rationale behind that transfer, what sort of cost savings we envision to achieve because of that, and just really an understanding of why we're doing that. You can bring that to the subcommittee if you would, but just wanted to get that in. Thank you so much.
Will do, Representative Dathan. Good to see you today.
Good to see you too.
Thank you very much. Senator Minor,
Thank you.
if you don't mind, Madam
Chairman.
Secretary, it'll be a couple minutes over the 3
Sure,
o'clock time frame, if
absolutely.
you're okay with that. Thank you.
So
Go ahead, Senator.
I know that there are a number of different tax proposals floating around the legislature, and I know that many of them fit into formulas that are currently existing. Have you done any review of those new tax proposals to find out whether they're going to require any additional staff in your office, any additional responsibilities in your office?
Senator Minor, one of the major tax proposals that the governor's put forth is in the transportation fund. It's the highway use fee. And yes, with respect to the staffing that would need to be stood up in DRS, the budget accounts for it. I'm happy to bring you more details at the subcommittee, as well as any IT related cost to program the system to capture that tax data.
How about
Yes.
outside of what the governor's proposed? I know that I think Senator Looney has a mansion tax proposed that would require some first-time taxation of property at the municipal level.
Those bills that have been raised are currently going through a fiscal estimate. The Department of Revenue Services will put out a fiscal impact statement that OPM does review. And so, yes, you will see that in the file copies when the bills, when that is finished, and happy to share if you have a question in that particular tax proposal, absolutely happy to bring that with us to subcommittee as well, or to send that through Ms. Keene for your information.
Thank you. Actually, if you could have it sent along, thanks.
Will do.
All set, Senator?
Yes, ma'am.
Thank you. So, ladies and gentlemen, we are through with our first half hour with the secretary. I know that everybody told me that they had at least 2 or 3 questions. If you did not get a chance to ask your question, please forward the question to Sue Keene, and I'm certain that we can send them over to the secretary to get an answer. And we look forward to seeing her or her staff in the working groups. Look forward to working with you, Madam Secretary. Thank you for giving us some of your time. Appreciate it.
Thank you, Senator. Have a good time.
You too. Up next, we have the comptroller. So just a reminder to everybody, please keep your questions to 2, only 2. I know everybody likes to sneak in that third one, or they make them to be, I know somebody's laughing at me right now because they see that they asked 3 questions. So because we don't have a lot of time with people, we just want to stay to 2 questions per person. If we could just try to keep to that 2 questions, that would be great. And again, I encourage you to send questions to Susan Keene and we'll get them over to the respective agencies on any agency, not just the Office of Policy Management, but on any agencies, and we'll send those questions along.
Madam Chair, I have to step off for a DECD meeting, and I'll be back.
Okay, thank you, Representative. Mr. Comptroller, how are you?
Very well, Senator. How are you?
Good. You know, we're trying something different this year. This way we can get in a lot more questions. And so we're going to start right with questions after you introduce your team. And I'm wondering if you could just introduce your team to us.
I certainly can. And since I can't see them all at once, I'm going to do my best, Senator. The Deputy Comptroller, Marty Carlson, is here. Heads of Technology, Angelo Romano. Head of Healthcare and Benefits, Tom Woodruff. Head of Payroll, Mark Bassoni. We have Josh Wojcik, who is Assistant Comptroller and our Policy Director. Our Legislative Liaison, Miriam Miller, is here. And I'm sure I'm forgetting people, but if I can't answer it, they're here.
Well, we all know them well because we call over to your office and you have great staff working with and for you. Thank you very much, Mr. Comptroller. I have a couple of questions, and then I encourage people to put your hands up in the chat so that I can go to you next. So I think the last time when we got a chance to talk, we talked about the partnership plan and it's operating in deficit. And I'm wondering, has the partnership plan run in deficit? And if so, who pays for those losses? And so that, going with the theme, that's two questions, not just a bifurcated question, it's two questions. Thank you.
Thank you, Senator. So yes, calendar years 18 and 19, the first 2 years of the program, it did in fact, claims ran ahead of premium. Not unexpected, because I know some of you, we were all together talking about regional differences in pricing. And we did have an initial wave, an overrepresentation of folks from Fairfield County, where frankly, healthcare is more expensive than it is in, for example, Wyndham or Tolland or even Hartford. So claims did run ahead. But what we asked the legislature for, I believe it was 2 years ago, and you provided, was an opportunity for us to do a regional, sort of an over-under, depending on where folks were, to make an adjustment in premium to account for the cost of delivering service. That begins to be implemented in 2021 and in 2022. But I'm happy to say that even without that, the stabilization of this group is running a medical loss ratio of 94%. I've seen some questions raised about that, but I'm also happy to say that our healthcare consultants, Siegel Consulting, not a small shop, pretty well known internationally, projects our MLR in this program for fiscal 22 to be 96.6, which is spot on where we want to be.
And MLR?
Who pays? MLR, correct.
MLR means?
I'm sorry, medical loss ratio.
Okay, because
I
know everybody likes to use acronyms, but a lot of times.
I don't usually, but yes. And then the question of who pays. Unlike any other program we may stand up in the future, we'll see what the will of the legislature is, the partnership plan has a shared risk strategy at the upper end with the state employee plan. A decision was made by the legislature and with Governor Malloy at the time that we have a common interest with municipalities, and we have similar goals and strategies for what we want to accomplish. And so at the end of the day, we true it all up across the state employee plan and the partnership plan. And there may be years where partnership is a little more than state employees, or vice versa. That gets trued up and spread across the entire book of business, which at this point is about 260,000 lives.
Thank you very much. I do have some questions that I will be forwarding over through Susan Keene to you, in keeping with two questions and additional questions going over that way. I'm just saying this so I can remind my colleagues. Representative Walker, followed by Representative Belinsky.
Thank you, Madam Chair. You mean you were talking to Matt Lesser? Was that what you were talking to? Just saying. Anyhow, good afternoon, sir. How are you?
Very well, Representative Walker. How are you?
I'm fine. I just have one basic question, and then I'll give you the other two the other question that we can get answered later. I was on a call with my community colleges today, and they said that their fringe was being paid for in a new way. Can you explain that to me, sir?
I can. Over the years, and no big surprise because we've had a number of meetings about fringe and its impact, particularly on our colleges and universities over the years, there's been a couple of different strategies employed by the legislature to help ease the burden of fringe on those institutions of higher ed and also on the UConn Health Center. So you've done everything from increasing the block grant to universities to try to offset that over time. And you recently made additional direct fringe payment subsidy payments, to the Board of Regents for the community college system. So that will offset their fringe.
So in other words, their fringe is now put back on them. It is not being paid by.
No, in fact, the opposite. It's being paid more by the general fund.
It is more, well, more is being paid by the general fund because.
That's right.
What I was told was that there was money that was now they had to be responsible for. So I've got to find out because I heard they did pay for UConn Medical, but the community colleges, the 16 million that we gave them the previous year was not there.
There may, Representative, have been some decision within Board of Regents for how they're bearing the burden of the fringe across the different colleges. That's not, I don't know the answer to that because as you know, we just deal with the system and they deal with the units.
So,
yeah.
So just so we know, it's the unfunded liability, not the fringe. It's the unfunded liability. If we could
It's the
remember,
problem.
is the unfunded liability.
Okay. All right.
Thank you.
Okay. Thank you. And then the other question I was going to ask, and you can send it to me, is how many people are you going to be losing this up and coming year with retirements coming up? And did you get any money from the COVID funds that we got from federal government? So those are the only two things, and you can send me that information later.
We're happy to report all of that to you, Representative. And Senator, you're right. The fringe benefit is the global definition of all of those pieces. And the part that is the unfunded liability is 88.3 of the total fringe. So it's a big percentage.
Yeah, that and this day, anything that's going to put more burden on our higher ed, especially our community colleges, is going to be, this is not the time. Thank you.
Representative Belinsky, followed by Senator Lesser, followed by Representative Baker.
Thank you, Madam Chair. And nice to see you, Comptroller Lembo.
Good to see you, Representative.
Thank you. I have some questions about the public option. Not that it's my questions are not that we shouldn't be doing it, but I just want to make sure we're going in with our eyes wide open. There's been a tiny bit of conversation about the medical loss ratio. It was 105 in 18. It was 108 in 19. But before we pat ourselves on the back for how effective we've been in getting it down to, I think you said 94 in 2020, and projecting forward, the pandemic has created a vacuum of untreated what would be normal people's preventative health and even elective surgeries. So I'd like to see a dollar analysis by year and some sort of actuarial assumptions that are made that take us forward from this point in time where in 2020, say 40% of all healthcare was foregone for reasons of unavailability or just a fear of going into a hospital where there are COVID positive patients. I don't know when we're going to get back to what we ever considered to be a normal situation, but it's not going to be 2020, and it'll probably not be 2021. So, before we set ourselves up for unanticipated large expenses, when we do return to some form of normal, I just sort of like to see it all in writing so that we can just flesh it out. You know, and I realize that's pretty open-ended and complicated. But it would, I think it would be very helpful to all of us to be able to have a really healthy conversation and be able to look at all of that number by number. And then
Would you like me to respond to that, Representative? Or
yes, you absolutely can. I understand that the response might be even longer than the question was.
No, I promise it won't be, because it sounds like it does need a longer conversation, but I understand the constraints that we're under in time. Let's always keep in mind that these are two different programs, right? The partnership is a program, and the other programs that are being considered now, calling them public options, are different, and they're structured different, and the backstop is different, and there is no shared risk in those programs. But I agree with you. I was really, I don't know, I had to ask the actuaries to dig down deeper on what does that COVID piece really mean. And I think it's interesting for me to point out to you that the medical loss ratio before COVID, in that period that ended in February of last year, was actually running below 100% as well. And we've seen with the state employee plan, and I think we can reasonably trend and track patient behavior based on this population as well, folks are starting to stack back into the healthcare system. They're starting to get their screenings and do that work. There doesn't appear to be what sometimes is called pent-up demand. There will be some, but I don't know that it is at a level that it will affect rate setting in our partnership, set rate setting or premium equivalent in the state employee retirement system. It just doesn't seem to rise to that level. When we tracked how much we would be able to save, I'm happy to talk about that more and pat ourselves on the back, save in the health plans from last budget cycle to this, we normalized claims. In other words, we extracted COVID as if it hadn't happened and normalized the cost of claims or the pace of claims across that period. So it didn't inappropriately alter in a negative way. So I think your concerns are well taken, but I think we have factored them in. Happy to talk with you more about that.
I also think when we look into it a little bit further, we may find some pleasant surprises because you know, there's definitely going to be a larger part of healthcare taken care of by telemed method, which will be a cost saver and a time saver for everybody. So, you know, looking at it from both sides. Thank you for the answer, and thank you for the conversation going forward with that. My other question is fringes and how the fringes might you know, provide savings with the upcoming retirement. You know, things like longevity increases. The people that are, you know, the recipients of longevity increases are going to be the ones that are most likely to be retiring. I'm wondering if there's something we can look at there that you know, that can lend some encouragement to you know, to maybe not capping, but you know, seeing a mitigation of acceleration of fringe benefits and stuff.
Thanks, Representative. The question of how would it impact fringe is obviously second or third to who's actually going. I think you make a reasonable guess about who would be leaving and who is eligible and would they be eligible for longevity. Even beyond that, you know, there's differences in the different retirement system tiers. So new employees coming in, even if it were head for the people who retire before that 7/1/22 or 6/30/22 date, will come in, you know, not at tier 1, 2, or 3 even. They'll come in tier 4, where the normal cost of that system is about 7%, 5 of which is borne by the employee and 2 by the state, which is a complete paradigm shift and not talked about very often, in that over time, that will go a long way to correct some of the issues there. So yeah, I think once we wrap our arms around who's likely to go, I would venture a guess and say it's not going to be as big as we thought it was originally. When you look at what the differential is between leaving early, for example, if you're already fully vested and you're going to leave in 23, it probably makes sense to get going in 22. But if you're leaving a year or two early to avoid any of the consequences of the change, it doesn't make financial sense in most cases.
Thank you very much.
All set, Representative?
Totally set. Thank you, Madam Chair.
Thank you, Representative Baker. Senator Lester said he would wait. So Representative Baker, followed by Representative Datham. I remind people you have 13 minutes, so please keep your questions succinct.
Thank you, Madam Chair. I'll make this real quick. I see that the Women's Business Development Grant is being cut. Is that being shifted, or is that grant coming a renamed grant, or are we seeing monies coming from COBIC, or
Thank you, Representative Baker. So thank you for bringing it up because it's on my hot list to share with you today. The Women's Business Development Council has been around since I think 97, has educated and trained about 15,000 people, helped women start 6,000 businesses in Connecticut, employing 8,000 plus people, and also helped them draw down $22 million in private capital to keep those businesses financed and moving forward. There was money in the budget over the last couple of biennial cycles for this organization. It was moved from the Department of Economic and Community Development to OPM, and then it was moved from OPM to our office at the request of Representative Pat Billy Miller, and we were happy to host because it's a very simple thing to move those dollars to them. To your point, the biennial budget that the governor has released does not contain those dollars. It is, to the best of my knowledge, they are not anywhere else in the budget. And we are hearing from OPM that it would need to be a legislative priority to put those dollars back in. And I'm happy to work with you and your colleagues to ensure that that happens.
So is it going to be named the same grant? Is it going to be, okay. So
yes, it's the same program, same nonprofit that would receive it.
Oh, okay. And then also another question in regards to your cloud, the iCloud program. Now, is that money, is that a one-time startup fee, or is it going to be over a period of time allocated? Are we going to see a service fee or some sort? How's that? Can you elaborate on that a little bit for me?
Certainly, Representative. Yeah, you know, whether it's remaining in the mainframe where we are now or going to the cloud, there's always ongoing maintenance software costs that go along with that. You're right. In a movement to the cloud of our program, there will be some hosting fees that will be different than what we've experienced before. But offsetting that will be, we won't need, you know, the racks that cater, you know, to back up our system the way they are constructed now. There is a combination of one-time and ongoing funding that would be necessary for this, but I think it really is the right time to begin this migration and get it going quickly because of the retirements that may be coming in 2022, because of the need to refresh the computer systems or the hardware. And so Angelo Romano, who's on the call here, has done a dynamite job, and he's staying in very close contact with the folks over at DAS to make sure that we're coordinating wherever possible to make sure that that goes smoothly, but miles to go before we're completely ready to wrap our arms fully around it.
So you're saying that you don't have an idea what the annual cost is going to be at this time?
No, at this point, but we'll try to break that down for you, Representative, and bring it to the subcommittee.
Yeah, thank you. I appreciate that. Thank you, Madam Chair.
Thank you very much, Representative. Representative Datham, followed by Senator Lesser.
Thank you very much, Madam Chair, and thank you, Comptroller. It's nice to see you today.
Good to see you.
I'm very pleased to hear about your answer about the Women's Business Development Council, that it is a priority of the administration because it is something that's super important to me and super important for women-owned businesses in Connecticut. My question really today is about the fringe, and I'm still trying to get my hands around how it works and the ins and outs that we have going on in terms of, you look at the overall budget of the agency, and it's about 300 million. The governor has about 300 million less than the agency requested for 23, and 200 million less in 22. And just trying to get an overall understanding of, it looks like, according to the descriptions, that there are changes in amortization phases, additional funding of actuarial amounts. Does your agency have any sort of write-up on exactly how these work? And also if, how we kind of rank up to other states in terms of our fringe? I'd love to get an understanding of where we sit compared to other states in the Northeast, as well as other states around our country.
Happy to, Representative. We'll pull additional information to compare us, and you can take a look at that. As you might imagine, a perennial question, not only at budget time, but throughout the year. You do raise an important point in the amortization question and the difference between the agency requests and the governor's budget. The governor's budget, and I highlight this right at the top of my written testimony, so I won't go into it in too much detail, wants to sort of change again the schedule to get up to a flat dollar contribution, percent of payroll rather, contribution to the pension fund. That's the second time that the administration has chosen to move that, or asked you to agree to move it. And by itself may not be the end of the world, but a lot of what is behind that is much more of a potential problem. It assumes that revenue will still come in at a pace that it's been coming in, that the capture that will happen around the volatility cap, now that we've hit 15% in the budget reserve fund, that those excess dollars will go and pay down unfunded liability. That's all fine as long as that all happens. But if one piece of that doesn't happen, you lead to a situation where you're shorting the payment to the pension fund, which just increases the long-term cost, and is one of the primary reasons we have a problem with our unfunded liability to begin with. So I understand where they're going with this, but I think we really have to think long and hard from a policy perspective if we want to, dare I say, sort of go back or take that kind of risk.
Because everything we do to pay down our pension fund as much as we can from our budget surplus saves us money going forward and helps reduce that long-term problem going forward. So I was feeling optimistic that we were starting to address this. And when I look at this, I'm a little bit apprehensive, and I'm just looking forward to, getting a better understanding. So if you do have any sort of write-ups on this, I'd greatly appreciate it.
Representative, our best and highest use might be to work with you to unpack what OPM tells you about this, since it's the governor's budget. We're happy to help sort of work through that once that comes from them.
Okay, great. Thank you so much. I won't take any more of your time. Thank you, Madam Chair.
Good to see you.
Thank you very much. And I also agree with the comptroller. I don't believe that we should be stretching this out any more than we've already stretched it out. Senator Lesser.
Thank you, Madam Chair. I'm actually going to, in the interest of brevity, pass on questions at this time.
All righty. So we actually have 5 minutes left, Mr. Comptroller. On the questions that we will send you, they'll be relative to the plan for the public option and how it interfaces with some of the other things that you have, on whether or not audits are conducted of the systems that you have independently, and some other things, just so that we can wrap our minds around some of this very complicated policies. And I'm trying to get people to understand that unfunded liability component. So that's why I always say, let's talk about the unfunded liability, because to Representative Datham's comments relative to let's get this paid down. We had 70 years of people not paying much, if anything at all, on the pension plans. And when we say fringe, then people think that a current state employee is costing that much money, when 88% of that fringe comment is from the long-term debt and is assigned to each individual employee. And as we have less and less employees, that number is going to get larger and larger. So we have to understand that component of it. Representative Walker, do you have any final comments for the comptroller? She's trying to do 2 meetings at the same time. Senator Minor, do you have any? Oh, here she is.
No, I'm sorry. I want to thank you, sir, and I look forward to talking to you and your team later on. Sorry, I'm doing a couple of Zooms. Sorry.
Happy to help in any way we can, Representative, as you know.
Thank you.
Senator Minor?
I'm good for now. Thank you.
Good to see you, Senator.
Representative France, are you on? I don't think so. There are so many committee meetings going on today. I know everybody's watching from their different committee meetings, unable to get over. We have all of the subcommittee chairmen who have all want to speak to you inside the subcommittee itself. I think that you're somebody that we're not going to skip on subcommittees. So I think that on the working groups, I think that we will, I'm sorry.
That's okay.
You have one of those interesting agencies which provides a lot. And I wanted to know, is Marty one of those people that's going to plan on retiring? She better not.
That's a frontal question, Marty.
That's a top secret.
It's top secret. Okay.
Top secret.
Oh, that's
Besides, Senator, I'm not old enough to retire.
That's true. That is true.
We're going to go with that.
Right. But I did get my first dose of the vaccine, so there's a hint.
There you go. Thank you very much, Kevin, for coming on and spending some time with us. And I know that people have a lot of questions for you, so I hope you'll be think kindly of us as we ask all these questions. So we'll talk to you soon.
Thank you, Senator. Thank you to the committee.
Thank you very much. And up next will be the Attorney General.
We are in the process of letting the Attorney General and his team in, Madam Chair.
Very good.
And I think they're all set.
So, good afternoon, Mr. Attorney General. How are you?
Madam Chair, good afternoon. Congratulations for being early.
Yeah.
Was not expecting to be called in early.
We're trying to stick to a time frame because it makes it so much easier for everybody. We were actually early a lot this morning. We actually finished a couple of groups very early, so we were able to get out for an extra half an hour for people to eat lunch. So, Mr. Attorney General, you know, we're switching around. We're not having people read their testimony. We have your testimony. We're trying something new this year.
Great.
And so what we would really like you to do is introduce your team to us so we know who they are.
Well, thank you, Madam Chair and ranking members, for having us. Let me introduce Assistant Deputy Attorney General Antoria Howard. She is in charge of our management and budget. And our Chief Counsel and Director of Legislative Affairs, Nicole Lake. There are others on the call with us, including the Deputy Attorney General, but Assistant Deputy Attorney General Howard and Chief Counsel Lake are with me making our formal presentation.
So, well, thank you very much. So I have a couple of questions. In looking at the numbers that you have in the agency, are all of your positions filled positions?
Are all of our positions filled positions? That's a big question. I guess the best way to answer it is we have 279, I believe, filled positions. We have more than 30 vacancies. We have approval to fill about 10 of those. There are also positions that are part of my office and operation that are paid for through other means, including positions that are paid for by other state agencies. So those are on top of the 279. So I'm just trying to be as accurate as I can be about where it actually stands.
So if you could, for the working group, bring with you the number of positions that your agency is authorized, the number that are filled, and the number of vacancies, and then underneath that, those that are in other agencies that you just referenced, and if there are any unfilled positions in those agencies too.
Yeah, would you like us to provide that to you in like a spreadsheet or some other?
Please,
form?
that would be great. Yep.
I'll ask Assistant Deputy Attorney General Howard to do that. And Tori, are you there?
Yes.
Okay.
She's shaking her head yes. As we were talking, she was
Good.
shaking her head yes.
Good.
So she was getting ready for that. And did you get any COVID dollars or federal dollars during this pandemic to assist in any of the issues that you had?
COVID dollars or pandemic dollars. Let me defer to Antoria. I don't think that we got anything explicitly.
No,
from our office.
Right. We received PPE, of course, and we've also put in a request anticipating our employees getting back to work. We have taken the liberty of putting up just barriers between cubicles. All of our people are not in offices. So we have put up plexiglass, and we have submitted for reimbursement for that. We have not received anything yet, but we're hoping that we'll be able to receive some of that money back.
Thank you very much. And sticking to the two questions, those are my two questions. Representative Walker.
Thank you, Madam Chair. Since you took my questions, I will just expand a little bit more on your vacancies. Also, we'd like to know how many people are slated for your retirement. Good to see you, Attorney General.
Good to see you, Madam Chair. How are you?
I'm living the dream. That's all I can say.
How many days a week do you have your grandkids at your place?
Since we started budget, 0. And but anyhow, just to let us know how many people that are able to retire.
So I'm going to ask Antoria to answer that question, but let me just say that I think it's north of 80 people who may be part of the retirement Mageddon, as we refer to it sometimes. What's really challenging for our office, Madam Chair, is that these are some of the most senior and experienced lawyers in state government, period. So many of you, particularly those of you who work in education and in health, you know, the hospital litigation, chef, names that you would know are people like Henry Salton and Ralph Urban.
Wow.
These are the big brains, not just in my office, but in our state. And many of them, 80 something of them, are eligible to retire. Henry and Ralph have already retired. I use them as examples because they're already gone. Jane Rosenberg, who was the second Solicitor General and the first woman to hold that role, has retired. And so it's just, there are many more like the three of them, and it's going to be really hard for us.
Oh, wow. That's very, very unsettling. I know a couple of them have worked with us in the House on settlements. And they've done a fabulous job.
Thank you.
So I'm scared. I'm sure there's some new ones out there, but it's really nice to know the caliber that you have in front of you. And that's very sad. So if you can just tell us, so 80, so that's all I really want to know. And thank you for your settlement. I could ask you about different cases and things like that, but that's not on appropriations. So I was just saying that so that my other colleagues understand this is appropriations. So thank you, sir. Thank you.
Madam Chair is not afraid to blow up my phone about those cases, just so we're clear.
Thank you.
I don't think any of us are. So Representative Datham.
Oh, thank you so much, Madam Chair, and good to see you, Attorney General Tong.
Representative.
Yeah, I was just about to say that Representative Walker started talking about what I'm concerned about, the retirements. But in thinking about this, looking at your staff, I was wondering, do you have a breakdown of staff by either, I don't know if you want to say like what side they sit in the legal side, or if they're more on the administrative side? I was kind of looking at your modernizing the Office of the Attorney General structure, and I'm kind of thinking about how some of the people fit into those buckets, and would love to understand what your sort of thoughts are about doing that going forward with your current staffing levels.
So they're all over the place. And so I will say, for example, we have impending retirements, not just on the, I'll call it the state representation side of the House. So that's the Henry Saltons and the Ralph Urbans of the world that work with all the different agencies of state government and represent the state and counsel the state in the state's functions. We're potentially losing a lot of people there, but we're also losing people on the so-called affirmative side of the House. So there are some very senior people, for example, in our antitrust section who lead all of our big cases, the generic drug price fixing case, our recent lawsuits against Google and Facebook, also antitrust cases. So we have a brain drain on those cases, and those are affirmative, meaning we go out and we start those cases, and we're the plaintiffs suing under state and federal law, and we're losing people on that side too.
Yeah, and I just kind of conscious of what you're saying. So I'd love to get, if you do have a breakout of staff, things that you represent, the state, that we actually are the plaintiffs. I'd also love to hear about the total amount of exposure the state has in terms of legal exposure. Looking at our legal department, it's probably bigger than, it's a state, so we're bigger than most corporate America, but I'm sure our exposures are pretty large out there. And I'd love to get some sort of analysis on what our exposures have been maybe for the past few years, and what we've been actually had to pay out for each of the estimated exposure. Likewise, if we have, I know you've been really successful with Purdue and other going out and being the plaintiff. And I'd love to get an idea of what sort of total claims we have also had on the other side of the coin, maybe for 3 years, and then what we've actually been able to settle. I'd really just, because I'm just trying to get a better sort of ROI on the, I'm an accountant by trade, but love to get it kind of an ROI on what the whole agency does overall, if that makes sense.
So the ROI representative is between 13 and 18 times what the state spends on my office.
Yeah, I saw that, and I was trying to get an understanding of how that breaks out, whether if it's on the things that we go out and pursue or we are actually sued.
Other than DRS, I believe the Office of the Attorney General brings in more money for the state than any other state agency. And so let me answer that question in a couple of ways, and I can get you more detailed information, but let me just answer it. It is obviously impossible for me to predict or report what the state's total exposure is at any one time. Suffice it to say, it's substantial. And our exposures can be in the millions of dollars. They can be in the billions of dollars. And we've been very successful since I became Attorney General in settling some of the biggest exposures the state has been facing. One is Chef. We've settled part of Chef, and it's sort of a two-part settlement, but we announced that last year, Chef versus O'Neill. And then the other major exposure was the hospital litigation, and that was potentially billions of dollars exposure, and that was resolved too. And there have been a number of settlements in the corrections space that have also saved the state. millions of dollars. So suffice it to say, in the past year and a half, there have been a number of key settlements to eliminate the risk to the state of, I would say, billions of dollars in exposure. On the affirmative side, so there's hard money. You may recall in the past month, I announced that I was part of a leadership group of AGs who settled with McKinsey & Company, the global consulting giant, for their role in helping Purdue Pharma juice its opioid sales and their role in the opioid crisis. That was a total close to $600 million settlement. Connecticut is going to get about 7.5 million of that. And I'm also, this has been reported publicly, but I can't give you details that are confidential, but I'll say publicly that there have been discussions about our investigation and pursuit of the major drug distributors, AmerisourceBergen, Cardinal, and McKesson, as well as Johnson & Johnson. These are huge companies, and what has been reported is that there are efforts at settlement in the billions upon billions of dollars. That's not done yet, and I can't say more than that, but suffice it to say, I'm on the executive committee of states in those cases, and those dollars, if we're able to consummate those settlements, could be substantial for the state of Connecticut. The other thing you should keep in mind is the money that we're able to save for the people of this state. So, for example, you may have heard that Comcast wanted to raise its rates on people across Connecticut, and still may do that. But I pushed back really hard. And at first they said, okay, we'll delay it for a couple of months. And I said, not good enough. And now they're going to delay it for about a year until 2022. Now I've reserved my right to fight them then, but at least we're getting close to a year of breathing room for the people of the state. And that's going to save people a great deal of money across Connecticut.
So basically, you are reaffirming that we need to have the best and the brightest in your department. And I'm pleased to hear that it sounds like we have some good people.
So I'm going to go back to the appropriations component of this, because I have other people that have questions, you two, because I don't want you to go down the rabbit hole of where we're going with litigation. Having worked in one of the most litigious departments in the state. Senator Minor, followed by Senator Lesser.
So before you completely try to close the rabbit hole, I remain interested in the New Hampshire, Massachusetts case, which I think bears a lot of significance for the state of Connecticut. And my question is, of the 80 that are retiring and the resources being spent in that area, is that something we should be concerned about? I, for one, don't see the lifestyle that we have come to understand better in terms of employee-employer relationships from a distance changing anytime soon. And so I think this is a situation we have to get right. So my question is, are we properly staffed there? Do we have any reason to worry about what we might do should that, is it much of a burden for us, or are you simply monitoring it?
You're talking about New Hampshire versus Massachusetts in the Supreme Court and around interstate taxation.
Correct.
Yeah, let me say, of course, my team is handling it. We have a strong team. It's being led by the Solicitor General, Clara Kindle. And so we're very actively engaged in it. But Senator Minor, I will say that cases like that require the strongest and most experienced appellate litigators, and we draw on all of them. And someone like Jane Rosenberg, who was the Solicitor General and has just retired, is a huge loss for our office. And so I will say that we can't suffer many more losses like that don't get replaced. And so right now I can handle it, and I am handling it. But I'm very concerned for big cases like this one that people with that level of experience, Supreme Court advocacy experience at the state and federal level, state Supreme Court, US Supreme Court. No, there's not a lot of people like that in my office, and we can ill afford to lose them and not replace them.
And so in terms of the budget and any restrictions on that budget, do you see there being enough restrictions where that will not be possible?
The budget, and I'm gonna let Antoria answer as well, but I think the budget as presented by the governor, I think meets our needs in the immediate and medium term. And I think we're gonna be okay under this proposed budget to address things like New Hampshire versus Massachusetts. We do need to hire more in order to bring in more money, candidly. And so some of those big cases, particularly against the big tech companies, in a lot of my opioids work, were light on staffing. And part of my reorganization and modernizing our structure is my strategy to try to be able to move people around so that when I need help, we can draw from different departments and different people where that may not have been possible before. And I do think that right now this budget works. I think depending on what happens in the latter half of 22, I think that our situation could dramatically change depending on how many people of that 80 retire. And I think we're all expecting that many of them, if not most of them, will.
Thank you.
Let me also say, not to put too fine a point on it, but many of you worked with me, and I'm very grateful to be your Attorney General. But I'm also very grateful that I have a lot of senior lawyers around me who provide adult supervision of the Attorney General, and many of them are eligible to retire. And so, you know, our senior leadership are people that have served the state for 30, 35 years. And let's just be honest, many of them are eligible, and it's going to be very challenging for me to lose that, you know, that level of experience that we lean on, that I lean on every day.
Thank you very much. Senator Lesser.
Yes, thank you, Madam Chair, and thank you, General Tong. It's good to see you. And
congratulations, Senator.
Thank you
look like
very
you're
much.
getting sleep. That should not be the case, but
I'm getting a little bit just at odd times, and I'm glad to hear that you're getting adult supervision from your senior staff there. It's a relief, I think, for all of us. It's a joke. Just specifically, obviously, sort of building on the questions you'd gotten earlier. Are there specific state agencies that we should be? How do we sort of focus on our own potential liability? Obviously, DOC inmate medical is a frequent flyer, yes. But are there ways that we should be thinking about potential liability from an appropriation standpoint, Representative Walker? Is any guidance for us?
So off the top of my head, and please don't take this as a ranking, and if I omit somebody, that's not intentional. Public safety, which serves the Department of Corrections, they are well past overworked, and they have maybe the biggest caseload, and it's unrelenting, and it's also the kind of work that burns you out. The second close sister to that is child protection. Our child protection lawyers were in court throughout the pandemic, and we're literally on the front lines in crowded courthouses because, you know, DCF doesn't stop working because we're having a public health emergency. And they're also well past overworked and overwhelmed. And I'm trying to fill holes there. We've had the department head and the deputy, basically department head, both retire in the past 6 months, which has been really hard for us. We have good people stepping up, but the two big dogs walked out the door, and that has been really hard for us in a department, again, where there's a lot of burnout for the lawyers because of the subject matter of DCF, DPH and DEMIS. Obviously with the public health emergency, really important. I mentioned Ralph and Henry, they were key in the health side of health and education. But, you know, DEMIS, also, it's really important for us as we do so much opioid work. And if some of that opioid money starts coming in, right, someone's got to do something with it. And the way that we look at it is, and the way we're negotiating these settlements is, that money's supposed to go towards what we call abatement. And to me, abatement means treatment, prevention, and addiction science, right? And you need people to implement abatement programs to make sure that money we bring in on opioids goes to confronting the problem. And a lot of that, I think, is going to fall on DEMIS. And we need people there, lawyers, to facilitate that and to make that happen. Antonia, am I missing any areas that are under a special pressure?
Our special litigation, I mean,
Yes.
they're down. Of course, Jane Rosenberg came out of that section. And they're also, you know, down, and we're trying to fill those. And they've been doing remarkable work over this past year, defending the governor with all of the challenges to the executive orders. So we're in the process of recruiting and trying to fill those positions. We've been authorized, as the general said, to fill 10 positions, and we're recruiting for those. And we're hoping with the budget that the governor has put forward, any vacancies, we're able to fill those vacancies within the budget. So we're hoping that we will be able to replace those people. We can't replace what we're losing with the knowledge and the institutional knowledge that's walking out of the door. But we're really hoping, and I know OPM has given us a little leeway to overlap, so that we can have people coming in trying to suck up as much knowledge from those who are leaving as they can before they're actually out the door.
So let me second that. Special litigation, there are elite group of lawyers, with all due respect to everybody else in the agency. In our office, people would admit that special lit, those are our elite appellate government administration lawyers. So when you have a question or want a formal opinion about the budget, right? Or the separation of powers, or when governor's council calls and says, we have this issue with the executive order that we would like to propose, and it's a really difficult issue that we have to sort out. Gaming, right? Gaming is a really difficult, legally difficult issue that we have to deal with. Those really, really tough legal questions for which there's usually no good answer, often because no one's ever had to confront the issue before, that goes to special litigation. And so we need that team to be fully staffed and fully ready to answer the most difficult questions facing the state.
One quick question. I know that, and I only asked one, even though it was a very long answer. Thank you, Mr. Attorney General.
Sorry, want to be thorough.
No, it was a good answer, but thank you. The other states have been able to generate a significant amount of revenue by pursuing financial crimes, anti-money laundering, and Bank Secrecy Act violations, for example. Is that something that would be a priority for your office? Because I think Connecticut sort of lags some other states in aggressively pursue. Maybe you disagree with that, but is that something that you would prioritize if those resources were available?
So we definitely don't lag other states in terms of what we're able to achieve within our authority. So I'm very candidly, and this isn't because of me, this is because of George Jepson and Richard Blumenthal. We're a leadership state among attorneys general and among the states, and we punch well above our weight. I mean, I lead the national generic drug price fixing case. That's a big case that George started, and so I inherited. And I wouldn't lead that if it wasn't Connecticut. Otherwise, it would be New York or California or Illinois, like really one of the big states. But as a relatively small by population state, it is rare that small by population states like Connecticut lead big cases like that. And that's because of our reputation. And so I think we for example, in the national mortgage servicer case, we were a leader on that. and brought in a significant amount of money from that settlement under General Jepsen. And we've done a lot in terms of, I know it's important to you, Senator, student loans and student loan borrowers, for example. And so I think maybe what you're seeing is that other AGs have different authority. They may have criminal authority that I don't have. And so they're able to get different penalties where they get different or more money that I'm not able to get. And, you know, I think that may be a source of the disparate amounts of money. Also remember, of course, that in any multi-state settlement, part of what each state gets is based on our size. And so even if New York and I are in the same settlement, they're going to get more money because they're bigger. And that's a subject of negotiation. But you can imagine, Senator, that when we split up, you know, $1 billion, we don't just split it up evenly 56 ways, states, territories, and the district. There's a lot of jockeying about who gets what.
Thank you. And I wasn't implying that your lawyers weren't good. I was just a resource allocation question. So I appreciate the clarification. Thank you. Thank you. And thank you, Madam Chair.
No, and let me answer the question. Do we leave money on the table? Yes, we do. And it's because I have to figure out where best to deploy my affirmative, right, plaintiff side resources, and I can't do everything. And if you lead cases, you get more money generally. So just so you know, I lead a lot of privacy cases, Equifax, Home Depot, big data breaches. Those cases, we recover more compared to our sister states because I'm the lead.
Thank you.
So thank you very much, Senator Lesser. And Mr. Attorney General, I have one final question, which you can bring the answers to the working group, and it's more about hiring of people to take the place of those 80 leaving attorneys. Are you looking at differing ways to hire people? Your benefit package is no longer one of the best in the country. As a matter of fact, it's if anything on the lower middle tier of benefit packages. And so I'm curious about that. And I'm also curious, are you increasing diversity hiring within the agency? And so if you could, when you come to the working group, because I sense that people have a few more questions regarding your agency. I'd like to have a better understanding of what you're doing to hire new attorneys and how you're doing the diversity aspect of that, and how you're responding to people who no longer have the same benefit package that your senior staff have. So those would be my questions. And I really want to thank you very much for coming today and spending some time with us.
Thank you.
And I think that our new methodology of sort of not having you read a paragraph or 2 or 3 or 4 to us, it works out better for us. We get to ask you questions, and we are really happy about the interaction that we had with you. So just thank you very much, and enjoy your day. Stay dry.
Thank you, Madam Chair. Thank you, everybody.
Thank you.
Bye. Bye. Madam Administrator, it seems to me that you have let in the Department of Revenue Services.
That is correct.
Thank you very much. Commissioner Boughton, how are you? Not used to calling you, used to calling you mayor. So I'm a little bit at a loss on what to call you now.
I think Mark would do pretty well, but
all right. I'm going to miss the Christmas cards.
It's great to be here.
Thank you very much for coming today. You haven't been here before, but we used to have people read statements, but now we're asking questions and taking your written testimony under consideration. But first, we would like you to introduce your staff.
Well, thank you very much. It's my honor to be here. As mentioned, with us today I believe on the Zoom call are John Biello, who's our Deputy Director, along with Terry Peterson, who is essentially our CFO of the organization.
Thank you very much. And I'm not certain who wants to answer the question, but the number of staff that you have, the number of positions that you have, are all of your positions filled positions?
Madam Chairman, they are not. We're about 60 positions that are vacant at this time. We have some hiring that is in the pipeline, some that is out for advertisement, and some that we are deferring on hiring at this time.
So when you come to the working group, if you wouldn't mind bringing with you the number of positions that are filled, the number of positions you have that are allocated or appropriated, the number of positions that are filled, and where you stand in the hiring for the rest of the positions that are vacant. So you indicated some are being hired, some are being advertised. So if you could just let us know sort of where in the pipeline those positions are. And did your agency get any federal dollars during the pandemic from any of the sources?
We did. We got approximately $540,000 in COVID money, if you will, mostly for PPE and for laptops for telecommuting.
Thank you very much for that. And we're on a 2-question per person so that we can get around the number of people that are here. And first up, I have Senator Lesser.
Yes, thank you, Madam Chair, and thank you, Commissioner, for coming before us. I have good questions about the 2 tax amnesties that I see in the budget. One is called the tax amnesty, and the other is about captive insurance. I was wondering if you could talk about how they were formulated and potential revenue loss associated with both of those tax amnesty proposals.
Well, the standard traditional tax amnesty that we're proposing is one I believe we did in 13. I think we did another one in 17. I'll have John Biello speak to the specifics of that. But in general, in each one of those, they resulted in significant recovery of lost tax dollars and people that have gotten engaged with the system and began filing on a regular basis. So they've been pretty successful. John, I don't know if you want to add anything to that or if you want to speak to the captive insurance issue as well.
Sure, Commissioner and Senator, thank you for the question. Great question. When we last ran a full amnesty program for all of the taxes that the U.S. administered, as Commissioner Boughton said, was in 2013. And at that time, we were budgeted to generate about $35 million in additional revenue. We ended up bringing in $193 million in revenue as a result of that program. And one of the things that was striking about that program is that there was an excess of 60 to 65% of those individuals and businesses that came forward were unknown to DRS. So in other words, they were non-filers or they were underreporters. So there was a significant amount of dollars that came in through that program that DRS would have never collected. So one of the questions we get quite a bit is, do amnesty programs just accelerate receipts? And the answer is no. We have not seen that in some of our past experiences. There's no revenue loss or there's no acceleration of revenue. As far as the captive insurance amnesty goes, that wasn't something that DRS proposed. That was a proposal that is a carryover from last year's session. I can get more information for you on that. I don't have too much in the way of information on what's expected to come in, what's budgeted to come in, but I'd be happy to get that for you, Senator.
Thank you very much. I think that's my 2 questions. I have more, but I'm going to be cut off.
Jeez Louise. Representative Datham, followed by Representative Baker.
Thank you very much, Madam Chair, and nice to see you today, Mr. Commissioner. Congratulations on your appointment. I just wanted to find out a little bit about how the audits of the agency look in terms of when you go out and audit taxpayers. Do you have any sense, I know you're new into the job, about the the number of audits that we do every year. What percentage of your staff is responsible for audits? You've talked about in the notes, they talk about a data analytics initiative. How do you envision that is going to be helping with collections? Because my feeling is a lot of states have gone away from auditing, and I have concerns that we as a state are leaving money on the table for collecting individuals' taxes.
Sure, I think you're on point there. Last year, we engaged in about 200,000 compliance actions, if you will. Those range from full-blown audits all the way to small corrective issues with somebody's return or with a business's filing that we've been able to correct. That has resulted in approximately $600 million of new assessments for the state of Connecticut. So we have a very robust auditing and compliance program, and we continue to obviously want to continue with that. The other piece of that, as you mentioned, is the analytics initiative, and this is a process and a procedure, an initiative that's been embraced by other northeastern states as well as New York City, the IRS, and we're going to and would like to use analytics to be able to determine certain predictive behaviors, predictive modeling, so that we'll know exactly what to audit, when to audit, and how to audit. It'll help in greater compliance efforts for us. It'll help us bring people into the system and to get them to file on a regular basis. And we think it'll put us at the very cutting edge in terms of being able to make determinations about what our tax plan ought to be going forward and to provide the appropriate, when asked, the appropriate recommendations to both the legislature and the governor's office. So this will do everything from helping us close the tax gap, as you mentioned, as well as build out fraud prevention and enhance that capability also.
Fancy ringtone there, Commissioner. Just wanted to find out, is this a third-party software? Are we, is it a software as a service, or how is that? And that'll be the end of my question. Sorry, Madam Chair, if I.
Hey, babe, are you in a meeting? No. Can you put some hot water on for me?
Okay, that's Ernie a demo. If you could.
Oh, sorry.
You got to mute.
Thanks,
I'm putting my own hot water on right now, so I fully understand. Go ahead.
My apologies. I thought I was on mute.
That's all right.
Thanks, Ernie. I'll take some tea as well. Anyways, your question, getting back to your question related to this, it's not necessarily a software package, although we will utilize software. This is about mining data that's we already in possession of. It's about leveraging other parties to use their data as well. And it's also about looking at various filings and tolerances and picking areas to audit that'll be the most fruitful in terms of us being able to do this. So we envision a department or a division, if you will, of about 5 to 6, maybe 7 staff members that'll specifically look at the analytics of the state, of our division, and then currently what's going on in some other states, and be able to provide the information and the auditing capability. Certainly the first thing we'll look at is auditing, and I think you'll see that we're projecting a pretty significant revenue lift in the second year of the biennium once we fully implement that initiative.
Great. If you can plan on bringing to the work group the sort of trends that I talked about in the investigations that you or audits, that would be great. Sure. Thank you so much, Commissioner. Thank you, Madam Chair.
Representative Baker, followed by Senator Minor.
Thank you, Madam Chair. Commissioner, good to see you this afternoon. As I was looking at the budget, I see that you're closing the Bridgeport Regional Office, and I see there's like a small amount of savings. Can you, is that more of a salary or a lease price, and how is that going to affect in terms of the maybe some of my constituents in Bridgeport and in the surrounding areas, and this office being eliminated?
Yeah, so I mean, it's a very good question. And I just want to let you know that one of the things that the department wants to do coming up next year is develop a very robust outreach program so that we can visit communities all across Connecticut, explain how to file their taxes in a timely manner, get the refunds in many cases that people are due that just never collect, and work with them at filling out sometimes which can be very difficult and complex paperwork. And also, we want to expand our dual language and tri-language capabilities so people can be able to fill out their paperwork in their native tongue so that we can get them into the system. Having said all that, it's counterintuitive that we would be looking at closing the Bridgeport office, as you point out. There's only 2 employees there from my understanding, and most of that work will then be driven into the cloud and using our online services. So you'll notice that we've developed a new interface for people, My Connect CT, and also our CTAX program that allow people to be able to take advantage of those in a much easier fashion than ever been used before. So we think we'll be able to save some money. John Bielo, I don't know if you want to add on to that a little bit. He has some of the history on the Bridgeport office in particular. John?
Sure, Commissioner. Thank you. And Representative, great question. Our Bridgeport office, as Commissioner said, had primarily 2 individuals who served the public from a taxpayer service perspective. The rest of the staff was all sales tax auditors that work in the field. When the pandemic came upon us, we were basically paying rent for 2 employees to house in that office. And we took a look at the services that we provide, and it was very evident that we could provide a much more robust services through virtual means, just like what we're doing today. We can serve so many more taxpayers this way. And to be honest, all through last tax season and even into this tax season that we're currently in, there has not been one request for an in-person meeting or some type of a complaint that we haven't been able to get services from the agency. So we've really done a great job in terms of providing other means of services such as virtual. Our phones have been manned. Even during the pandemic, when everybody went to virtual work, we didn't experience any wait times on our phones. We've got many questions coming in through emails. So we've got all of the capabilities covered. And so far we've been doing pretty good with it, and we've been very responsive to taxpayers' needs, and we'll continue to do so.
So this reduction is basically will be rent.
Yes.
Oh, okay. And then one more question. So are we doing any, are we still making requirements that people pay their back taxes payments and stuff, or are we doing it deferred at this particular time?
Well, right now we're planning on an April 15th filing deadline. Obviously, if the governor opts to extend executive orders and give people more time, we'll do that. We're also been taking a very compassionate approach to people who we recognize are struggling in this difficult time. And to be very frank with you, we make decisions based on a lot of the personal circumstances that people are facing and offer things like payment plans or deferrals until they get to a point where they get back up on their feet. We know coming out of COVID, it's going to be a difficult time for all of us.
Okay. All right. Thank you. I appreciate that answer. Thank you. Thank you, Madam Chair.
Thank you very much, Representative Baker. Senator Minor?
Thank you. Good afternoon, Commissioner. So it seems to me that the world is moving to a telecommuting model. There's some question as to whether that's going to be short-term or long-term. But I think most of the employees that I've spoken with that have had the opportunity to telecommute, I think you're going to be hard pressed to get them out of that mode. My question is, with the pending case for New Hampshire versus Massachusetts, do you have any feel for what kind of a tax reorganization we may be in for here in the state of Connecticut? I know that there is some legislation that specifically deals with people that we know are telecommuting. We've had a lot of real estate transactions where we probably have about a fair number of individuals that came in under the last tax kind of clemency program that you weren't aware of, didn't even know they existed. Um, do we have a sense of how many of these new tax filers may exist in Connecticut at this point because of their movement to, let's say, the western half of Connecticut and are telecommuting?
Well, I would say that we have about 74,000 filers that are impacted by the commuter tax, as you mentioned. That's the convenience rule. So the legislature, it'll be up to you all to deal with this after we get through this initial hump of the 2020 filings. You know, I certainly have ideas, but you know, I'm not in the position of making those policy decisions. That'll be up to you and the governor's office. But when asked, certainly be happy to provide whatever thoughts I might have on the issue. I do think the legislature will have to look at telecommuting a little bit different. I do think it's beneficial to have our taxpayers who live in Connecticut, whose businesses may be located somewhere else, another state, paying Connecticut. In most cases, our top rate is, as you know, lower than it is, say, in New York or other states. So financially, it benefits them to do that, and it benefits us because we're recovering more revenue than we anticipated. However, we do have the money grab that's happening by New York State, and I think we need to be very robust in our approach to this and fight this all the way to the Supreme Court to say, look, you know, we don't agree with you reaching across the border, digging into our taxpayers' pocket. That money belongs to the state of Connecticut for the benefit of our taxpayers. I also say to you that after this legislature acts on what's currently in front of them, we'll have to put out some guidance for the 2021 tax year, meaning that if you're still working from home because maybe your company hasn't reopened yet, you are liable for 2021 taxes, both in Connecticut and New York will make a play for that. And you're going to have to fight it out with New York until we get through the court case, as you mentioned. So it is certainly a conundrum, but my advice to the state and to policymakers would be don't give up the fight there. I think we've got a great case, and I think at the end of the day, we can realize a significant windfall of revenue that really belongs to the taxpayers of the state.
And so while that deals with the people that we know about, I mean, those would be filers that we currently have and have had. The other population that I'm talking about, the Secretary of State mentioned there were approximately 100,000 new voters in November.
Sure.
I could tell by absentee ballot request form, given the number of addresses, that many of them were new. They were new to the area. And so my question is, what effort does the Department of Revenue Services undertake to try and identify how many of those individuals would fall into the same classification? Clearly, they would owe us no tax at this point because of New York having the higher tax rate. They pay in New York, and we're entitled to nothing. But if a court decision should reverse that scenario, theoretically, we wouldn't even know they exist here.
Yeah, I would say this. The current law, Senator, is that even if the legislature acts on what's currently in front of them, once that's done, current law is that you owe in Connecticut. If you just moved here and you're working in Connecticut, but the business you work for is located in New York, you owe in Connecticut. It's New York that the ones that are trying to reach across and grab your money. So you're going to have to fight that out with New York. Now, if we win the court case, then obviously you only owe Connecticut and you won't owe New York. So we think that some outreach, first of all, we're going to issue guidance. Once the guidance has been issued, then we're going to try and conduct some outreach to try to hit some of those areas, as you mentioned, where we have new residents that are living in your neck of the woods and my neck of the woods and other places, and sort of explain to them what their liabilities are. Obviously, we'd like to recommend that and work with the governor's office on that, work with the legislators and the legislature on that, so that people are aware of all the rights and the benefits that come with living here in Connecticut and what the responsibilities are.
Thank you.
Thank you very much, Commissioner. Are there any other questions from anyone? You know, Commissioner, I think you got off pretty easy for your first time in front of the Appropriations Committee. So I congratulate you on your new position. I look forward to working with you. And I think that's all we need right now. We'll probably have you come to the working group a couple of times to see where we are with some things. And we hope to have a long, healthy relationship with you and the work you plan on doing. Thank you.
Thank you, Senator. Appreciate your time.
I think we have up next, we have the Office of the State Treasurer. Are they here?
Most of the team is, the State Treasurer himself is not on at the moment, so if we could wait for a few minutes, Madam Chair.
Sure, why don't
I know
we?
I know he had another commitment, so if we could just wait until his 4:30 time slot.
Okay, so we'll wait 9 minutes. In 9 minutes, we'll come back. We'll stand in recess for 9 minutes.
Yeah.
Good afternoon, Treasurer Wooden. Are you there?
I am here. Hi, Senator. Austin.
Nice to see you.
Nice to see you as well.
I think we're all going to start coming back on. At 4:30 we'll start, just another less than a minute away.
Okay, great.
Have you talked to my friend down at the Mashantuckets lately?
Yeah,
Chair.
maybe a week or so ago. Yeah, no, they're still pushing.
I know. As long as they protect all those workers I have down here in Eastern Connecticut.
Yes, no, lot of workers. So, but they, as I'm sure you know, they opened up another tower.
Yep.
So that's a positive sign, although I keep seeing reports that they have to supplement the revenues that they pay over to the state.
Yes.
So.
Yep. Yeah. We're belaying that for other industries, just not theirs. Much longer discussion, Treasurer.
Yeah.
So it's 4:30. Thank you very much for coming this afternoon. And I appreciate you taking the time out of your very busy day to come and talk about your budget with us. We're doing something different this year. So we're going to go right into questions after you introduce your team. So if you would take some time to introduce those you have brought with you.
Sure. Thank you very much for giving me this opportunity. And with me today is Daryl Hill, who's the Deputy Treasurer. Also Steve Meyer, who's Interim Chief Investment Officer and Assistant Treasurer for Cash Management. Sarah Sanders, who's the Assistant Treasurer for Debt Management. Maria Greenslade, who's the Assistant Treasurer for Unclaimed Property and the Second Injury Fund, as well as Alex Marcellino, who's the Assistant Treasurer for Strategic Planning.
Well, thank you very much. So I'm going to start off with a couple of questions vis-a-vis positions and federal dollars. So I'm wondering the number of positions that you have in your budget, are all of those positions filled?
No, they are not filled.
So how many do you have that are filled positions, and are you in the process of hiring those that are not filled?
We have 123 filled positions. Out of that 123, just to be clear on the budget impact, 45 of those are general fund positions. The others are kind of self-supporting out of the programs. And we are currently authorized to refill 6 positions that are vacant.
And are there some positions that are in the budget that are not either filled or authorized? Do you have some that will remain vacant?
Yes. So our total allocated staffing level is 156 positions. And so again, in 123 of those are filled, and we expect to refill in terms of replacements 6.
Well, thank you for that. And I'm curious if you could just bring or send those numbers to the committee. That would be good, just outlining just what you just said. And then I'm wondering, did you get any dollars, federal dollars, either through the CARES Act or any other federal program in the last year relative to dollars coming in to the state?
Yes and no. We got them all as the treasurer. But if you're asking for use by my office for our office purposes, no.
Okay. Thank you for that. I should have caveated that. I know better. I should have caveated that. So the next step to prepare yourself for questions from is my co-chair, Representative Walker, to be followed by the subcommittee chair of the committee, Senator Lesser. So Representative Walker.
Thank you, ma'am. Thank you. Thank you, Mr. Treasurer. Good to see you. And
Hi.
And Daryl, that beard's getting longer, okay?
And it's great to see you, Representative Walker. You're
Thank
looking great. Yeah.
I want to start with my colleague. We go back and forth sharing the same questions, but in the amount of money that you've received from the feds, what is that total amount that you have, that the state of Connecticut has received for COVID dollars?
I'm gonna ask the Deputy Treasurer Hill or CIO Steve Meyer, what's the latest number that's come in for the state?
Good afternoon, sir.
Yes, hello, it's Steve Meyer. I believe the number is about 1.398 billion in total that's come in from the CARES Act to the state. I also believe that there's been some additional payments to support extended mortgage and rental moratorium.
Rental assistance money.
Yes, yes.
Okay, and that money is that up to December, or is that earlier?
That's up to December. That has come in last calendar year.
Because because there was a tranche of money that came in December, and I thought that was,
yes, ma'am.
I thought that was about 1 point something billion, and I thought we had received a lot more before that. So that's why I'm asking that.
There wasn't an additional billion that came in December. There was, again, much earlier in the year, calendar year 2020, again, about almost 1.4 billion in additional funds that have flown in, again, to provide that assistance, which I think was about 250 million, if I'm correct.
Is there, could we get a tally on that, please?
Absolutely, ma'am.
For our subcommittee, that would be really, really helpful. And that was kind of a couple of questions, so I don't want to do Senator Lesser, but I will ask, can you just give me a brief overview of what is your baby bond proposal?
Certainly, the baby bonds proposal, and this is just to take a step back, this is part of, what I believe from a policy perspective as a state, we need to start to address some of the structural inequities. And this is one way, or one tool to do that. Baby bonds is creating accounts, endowments for every poor child born in Connecticut. And, using right now using a proxy of enrollment in Husky, right? So we know on average how many kids are born who are eligible for that program on a yearly basis. Creating those accounts to level the playing field. The state would make a contribution at birth or shortly thereafter, and that would be invested over time, in some respects similar to a CHET. And at 18, there would be 3 things that those funds would be utilized for. 1, education expenses. 2, home ownership. 3, investing in a business. All kind of significant indicators of and contributors to the racial wealth gap in our country. And so that's the purpose.
Thank you. That I like that, and I just wanted to get a chance to sort of hear a thumbnail. I know we're going to have a hearing, but I think it's important that people hear about this. So thank you.
No, thank you. I'll talk about it every day, all day.
Okay, thank you. Thank you, Madam Chair.
Thank you very much. Senator Lesser, followed by Representative Baker.
Thank you, Madam Chair, and to listen carefully to Representative Walker, I'll be very brief. Just have one technical question, Mr. Treasurer, and thank you for being here. Can you just talk, I had asked earlier Secretary McCaw about the change in the use of bond premium dollars, and I just wanted to see if you wanted to comment on that.
Yes. So the use, and in fact, if we could just quickly go to a slide we can put up on slide 2, I believe it is, Jen. It'll take longer to get the slide up, Representative, than your question will take. But I will start by saying the use of bond premium. Premium is what we get, funds we will get upfront from investors when we issue bonds in order to have a lower interest, or we'll pay a higher interest rate for that, and it's offset. So an upfront payment in exchange for the state paying a higher interest rate over time compared to the market rate, right? So what the state has done, we believe bond premium best practice is to use those dollars to actually pay for capital expenditures, right? Rather than to pay for debt service payment ongoing, right? Using it to pay for new capital expenditure projects is a way for us to reduce our overall debt burden over time. And I do not believe it is best practice to utilize that in the way in which the state is currently doing so. As a result of that, in that perspective, the state passed legislation, you passed legislation to cease that practice, and it was 2 years from the passing the legislation. The governor's proposed budget eliminates that. I, like everyone else, recognize that we have significant fiscal challenges that we face, so I understand the need for some relief and some pressure. I disagree with eliminating it altogether. I believe if we're going to deal with this moment of fiscal stress, we should perhaps delay the implementation another 2 years rather than eliminating it altogether. Because the reasons why the legislature saw fit to put the current law into place, those reasons are just as valid today. And so that is my view on that.
Thank you. We'll keep it to one question, Madam Chair.
Just to keep a couple in the pocket so that you can spend them later, Senator Lesser.
I'm offended that you would insinuate.
Representative Baker, followed by Representative Datham.
Thank you, Madam Chair. Good to see you, Treasurer. Senator Lesser kind of asked half of my question, but so is there possible that you can get just elaborate on what we can actually use those bond premiums for to kind of leverage or balance out some of our debt and debt services? Where we can allocate some of that?
Yeah, so instead of using the premium, instead of borrowing more for it, call it a new school, borrow less, use bond premium to pay for that capital expenditure. And so that's the choice. Or we can borrow more and then pay for that ongoing higher debt service. And I don't know if Sarah, Assistant Treasurer for Debt Management, wants to comment on this.
Treasurer, yes, I think as you outlined, those are the choices. One is to either pay for the project and reduce the amount of borrowing that you have to do. And the other option is to use it to pay current interest on bonds. They're tax exempt bonds, so we're limited how far we can go, but we tend to use them to pay interest for about 2.5 years on bonds. So that provides, budget savings for 3 years in the debt service budget. But if we were able to use it to actually reduce our borrowing, we'd have savings for 20 years, lesser amounts per year, because we'd be borrowing less.
Thank you. I appreciate that. And another question in regards to, as I look at the, so for instance, in UConn 2020, the debt services, I see that there are, there's more of a slight decrease in the year 2020 and then up in 2023. Is there any particular reason why? And are we also, are we looking to pay down more of that over a period of time, or are we just trying to, because I know we have more of I believe it's like for the next 10 years. Are we just trying to spread it out?
Sarah, you want to comment on that?
Okay, yes, I do see, there's a little reduction there, and then it goes back up on a natural incline. But I think that little reduction may have to do with the fact that the last UConn bond sale was delayed at least 6 months because they hadn't deployed all their funding yet. And so we wait until they actually need the funds to issue the bonds. So that probably accounts for that. We issue those bonds over 20 years. And the future issuance, that program is starting to come to somewhat of an end in a few more years. So issuance will cease at some point.
No, okay, thank you. I do have some other questions, but I will submit them in writing. Thank you.
Thank you.
Thank you.
Thank you, Madam Chair.
Thank you, Representative Baker. Appreciate that. Representative Datham.
Thank you very much, Madam Chair, and thank you, Treasurer Whitten, for your presentation and that you sent over. My question is more around our improved bond ratings that we've received as a state. Has your agency quantified the amount of savings that we will receive for having improved ratings and being on this debt diet, if you will?
Sure. Thank you for that question. Our improved kind of credit standing is, one of the things that I'm very proud of in terms of our state accomplishing recently. In terms of quantifying, I don't believe we've done an aggregate quantifying, but for example, I don't know if Sarah, if you recall, so on our first major GO bond issuance in the state, and this was at this point we received our first ratings outlook upgrade from Standard & Poor's in 18 years. And so I know at the time, Sarah, we did a comparison of the numbers in terms of the debt savings on that compared to where we stood doing the same type of transaction in the previous year. Do you have that number?
I'd have to check, but somehow 40 million comes to mind for that first sale.
So yeah, so that gives you, so that first sale was a billion that we ended up issuing. It was 850 million, but the demand was so great, we were 5 times oversubscribed. We ended up going to $1 billion, and Sarah, we'll get you the precise number, but that gives you a sense of scale as to when we improve our credit standing, what that translates into in terms of long-term savings on our borrowing costs when we issue. And since then, we've issued several times in the midst of the pandemic, and we've been rated by all the major credit rating agencies. And during that, while 13 other states were downgraded, Connecticut has maintained a stable outlook from all of the ratings agencies. And we've received, whether it's our UConn 2000 bond program, our general obligation issuance, in several programs, we've received the lowest interest rates in the history of the programs. So we are doing, in the midst of so much doom and gloom and pain that's happening in our state, we should acknowledge the good work that the legislature and my team and everyone's doing to improve our credit standing, which does translate into real dollars in savings.
Absolutely. I fully agree with you. And secondly, I just wanted to commend you on the baby bond program. I think it's a fantastic opportunity and really hopefully addressing some of the issues that you're hoping for it to address. So thank you for your leadership on that.
Thank you, Representative.
Thank you very, very much, Madam Chair.
Thank you. Mr. Treasurer, I'm just curious. I think my colleague, Senator Lesser, talked a little bit about the one component of how we would handle certain debt service accounts, but I'm a little bit concerned about the 3-year push off of the pension system. Have you looked at that in the governor's budget?
In terms of which?
In terms of the governor is extending the payments on the pension out another 3 years, which I think is, personally, I'm concerned about that component of it. Have you had a chance to look at that? You're responsible for investing our pension funds. Does this not set us up for continuing the same problems that we've had before?
Well, yes, in terms of, anytime we delay, and I believe this is on the state employees on SERS.
Yes, it is on SERS.
And yes, right. So there's always the tension, so the answer to your question is yes. If we delay what we pay in to the system, that has a compounding effect in terms of depressing, what we're able to invest. And so 3 years, yes, that will have that effect. And the tension, of course, is trying to meet current needs. And, and I know that that's what the governor is attempting to do in that budget, but yes.
Would it push us beyond the 2046 timeframe of getting our pensions paid down? Do you know?
Sarah, do you have that?
Yes, I don't believe his proposal delays the final amortization year for the SERS. It just smooths out for 3 years the transition to the level dollar method that we're trying to get to, which does reduce contributions for 3 years. But I don't believe it extends the final
maturity date
amortization year, which is good.
So does that set us up for a very large payment to get us up to the flat funding, Sarah? Do you know?
Well, I looked at the fiscal analysis and it results in some less contributions, but I didn't see any like balloon payment. Yes, I leveled up. It does, the fiscal analysis I showed that I think was done by OFA does show that once we get to the level dollar, it is going to be a higher level dollar amount for the remaining period mathematically, but it wasn't any kind of cliff or anything.
But from that point of getting to that level dollar amount, does it create a larger gap between the level funding and where we are today? Does it make it harder for us to get to that funding, that flat funding level? I know I'm probably not asking it in your language. I apologize.
No, that's fine. Most people don't understand my language, so that's good. But if you're thinking of like are you asking about like our funded level and ratio of the pension plan?
So he's paying the pension off at X dollars today, and he is leaving that. He is not bringing it up to the flat funding. He's pushing it off for 3 more years. And so the dollar amount that he's paying today, does that gradually go up at a lesser level, or does that stay here for 3 years and then pop up to that flat funding?
I believe it gradually goes up. It continues to go up, but at a lower level. And then when you get to your level, it's higher.
Right.
Thank you. I'm just a little concerned that because when we did that, we wanted to get to that flat funding level and stay there. So I'm just a little concerned that that will put us in a difficult position once we come out of the pandemic. And I'm just worried about that component of it.
Yeah, and so it provides some relief right now, right, in exchange for a trade-off of a higher, gradually moving up in a higher payment that's level for the duration. As Sarah mentioned, it still will be paid off fully at the same time frame, right, which is a good feature. And And in doing that, so it's creating some capacity or some space kind of in the current budget for that. You know, and certainly the hope and the thinking, I'm sure, is that as we get there, our economy will be stronger and there will be other metrics to make up for that at the time.
I just, you know, I've heard that our economy is going to get stronger for my entire time that I've been in the General Assembly and for my entire time on as chair of appropriations. And we've never gotten to that point where the economy has been stronger. So I'm a little bit concerned. I'm just concerned, and I just wanted to know what you thought of that process. It makes me think twice about wanting to do that. I understand trying to put room in the budget to do sort of the general fund human services needs that we have to take care of. But I am worried about this component of it because the sooner we get that paid off, the better off the economy of Connecticut. It'll immediately take so much pressure off the budget that, you know, and you may be around for that. I, however, will not be around for that. And I'd like to set it up for a far better budget so that people don't have to take from one and put into another just to make ends meet. And that's where we are right now.
Yeah, and I'll just say, I mean, I think your concerns are well-founded. And anytime we utilize budgeting in that way, we should just be very mindful of what we're doing and intentionally make those trade-offs.
Correct.
Right? As a matter of policy, just so I agree with your concerns for sure. And just, you know, when we adopt a budget or when you adopt a budget, that the costs which you pointed out and you're identifying are worth it for those trade-offs.
I just think we have to recognize what we're doing. That's all.
Yep.
Be where we're going to be. Are there any other questions for the treasurer? Thank you very much, Mr. Treasurer, for coming and speaking with us today. I really appreciate it. Looking forward to seeing, I think they'll have some questions at the working group, and I do know that we will have you at a public hearing on the 3 bills that you gave us. So that'll happen soon. So again, thank you very much.
And good luck in your work.
Thank you.
Thank
Speaking with us today, I really appreciate it. Looking forward to seeing, I think they'll have. Somebody has their mic on and they're listening to the. That we will have you at a public hearing on. Up next is the Department of Administrative Services. And I think that that's our last presentation before we head off into the public hearing.
Madam Chair, I don't see Commissioner Jabal yet.
Okay.
One of the staff people can confirm whether or not he's on.
Somebody's connecting right now. Oh, that's
Good
not
evening,
Josh.
Senator Austin, Representative Walker. This is Eleanor Michael, the Policy and Legislative Advisor at DAS. How are you?
Good. How are you?
Good,
Is
thanks.
the commissioner coming on?
Yes, he should be joining us momentarily. He is currently over at the governor's press conference, but he is aware that this is starting at 5 p.m., so he should be joining us momentarily.
All righty, then we'll just wait for that.
Thank you.
Eleanor, do you know if he's almost here?
He's here. He's here. We'll let him in.
Okay, thank you.
Sorry, I got called away.
Hi, Commissioner. How are you?
Hello, Senator. I'm sorry that I'm late. We literally just finished the governor's COVID press conference.
Yep, those are your daily events. It's good. So Commissioners, good thing to see you here today. We do have a new way that we're doing things rather than reading a letter to us. We are reading that by ourselves and getting right into questions, which allows us to ask questions on anything that members have questions on regarding DAS. So my first question for you is, can you, on your, the number of people that are assigned to the Department of Administrative Services has changed over time. Can you get to us an Excel sheet that sort of says where your positions have changed on one sheet? This is what's appropriated or allocated for your department, those positions that are filled, those positions that are not filled, if they're paid for out of other funds other than the general fund, and the much touted human resources change that happened. If we could know where people are physically located and who they report to from those physical locations, so that we could see that better. As I told you before, I think that's one of the changes that's been made that has created some angst and consternation, and we really want to understand where we are and on that particular one. So if that could come to the working group, that would be great, or you could send it over to Susan Keene so that we could pass that out amongst our members. My second thing that I would like to see is I'd like to understand, did you get any federal dollars for your agency in any way whatsoever, whether it's COVID, CARES Act, ESSER, whatever the funds happen to be? Did you get any federal dollars to assist your agency during the last year or so?
Absolutely. Thank you for the question, Senator. We will certainly send you a spreadsheet with all the position counts and filled and vacant for the HR centralization personnel, the detailing of where people are physically located. So we can absolutely share that with you. And on your second question with regards to funding related to the additional federal supports for the pandemic response, yes, DAS has been involved in that effort extensively, as you probably can imagine. Key areas where we have been involved financially has to do with major categories. I'll just touch on our expenses related to cleaning, incremental expenses related to cleaning and sanitizing state office buildings. As you know, we're the operator of much of the state's real estate portfolio, and so we've incurred additional expenses related to that. We funded out of COVID-related funding that came to DAS some consulting support related to our reopening efforts last spring that I think have been well documented publicly. We've invested a considerable amount of funding to expedite the remote working of state employees through expansion of our telecommuting options that have enabled our state employees to remain productive despite the disruptions from the pandemic by migrating a lot of that work to teleworking during the pandemic. Yeah, those are kind of the major categories, but we'd be happy to provide additional details on that.
Thank you very much. And I do have a couple of other questions, but we're on a 2-question maximum per time frame. And so I'm going to turn you over to Representative Walker, followed by Senator Lesser.
Good afternoon, sir. I know you're tired. It's 5 o'clock, and how many press conferences can you do in one day? Good to see you. Good to see you. Thank you for coming before us. I'm going to sort of piggyback of what my co-chair brought up, and in looking at your budget, since the last voted budget, which was 2020 to today, to this budget that that's presented before us, your budget has increased by about $23 million. And in looking at that, and then looking at the number of people that you have about 177 people that you've added. And I'm just doing personnel. I'm not doing your whole budget. I'm just talking about personnel. I should clarify that. And then when I divided that into that gives you a salary of about 129 average. So obviously your positions have all been they're professional positions in what you're doing and shifting in your budget. So can you send to us the whole? I know you did last year send us a sort of a graph of where the positions were. I'm sure they've changed a lot since last year. So it would be good if we saw an organizational chart of where all of the 177 people are in your organization. And also to sort of give us an idea of what your thoughts are on what you were going to do with the different areas. One would be the IT. I guess the other would be human resources. Human resources is in your agency, correct, sir?
Correct.
Okay. And the labor relations is in OPM.
That's correct.
Okay. So that we can kind of see, because there's a lot of moving parts in this. And when we expand that quickly and that much in one agency in less than a year and a half, we need to understand that. And it's a shame that we really didn't have an ability to sort of have a real conversation as a whole appropriations chair, but I mean, committee. So I think it'll be a good conversation for all of us to have. And in the addition of the IT, can you send us, how did you come to what you wanted to do with building it? How did you make those decisions on the direction you wanted to go with IT for the state? I mean, I agree with you totally. Cobalt paper and all that stuff is not the way you run any type of business, without doubt. But I wanted to sort of understand also why you chose the areas that you chose to enhance, because I think some of the agencies, as we heard today, are not enhanced. They're working on a shoestring in many of the agencies as far as IT is concerned. Their issues, and a lot of them brought up IT as a need for them to expand. So I guess the question would be, how are we bringing in everybody else into the fold of what we want to do with IT? And I think that's it. If I have any more, I will send them over through Sue Keen. But the expansion of DAS, I think, is something that we would have liked to have had more conversation about, and been part of that conversation in the development. So, and I know COVID, we're all kind of stuck behind hard place, and I understand that, but that's a big expansion. So I don't know if you wanted to do I have a couple of minutes to ask him?
Yeah, I touch on a couple of key points there, Representative, and thank you for your questions. First of all, with regards to the increases in the DAS budget, I just want to point out very importantly that almost all of that is related to transfers that are net neutral to the state. So, for example, we've touched on HR centralization. That is effectively moving people from one agency to another. That is not increasing spending. Mm-hmm. In fact, we believe, and we've put into the budget a belief that we can run the state's human resources functions with higher service quality and at a lower cost by centralizing it as we are doing. And so, a lot of these increases, another good example would be in the IT services line. we signed a statewide contract with Microsoft. We used to have a dozen agencies doing their own contracts with Microsoft. You can imagine many of the problems associated with that and the lack of leverage of our purchasing power. So we consolidated that under the leadership of our CIO, Mark Raymond, who's on the line, into one statewide contract. But that then requires us to take the spending that had been occurring for Microsoft and all the other agencies scattered around and consolidate it into one place where we can write one check to Microsoft, and that came together in DAS. So the moving parts you're seeing are largely transfers. They're not incremental spending. And to the contrary, much of what we're doing in DAS is involved in making the state more efficient and improving our cost structure while we look to improve the services. With regards to IT, thank you for asking about that. This is a topic that we're very excited about. And as you point out, we came to this initiative largely because of our observations that many of our agencies are really hamstrung in their ability to leverage modern technologies to improve the services that we provide to the people of Connecticut and be as efficient as we can internally. Many of our agencies are just, they're subscale. It's hard to be up on top of the latest trends and implement the new technologies when you have a small IT department in one agency that's kind of trying to keep the lights on and do everything at once and not really have the expertise in certain domains to drive new initiatives for it. And so by bringing our IT resources across the state together, it gives us the ability to specialize and to build up pods of people with expertise in certain areas that can drive initiatives forward and improve the overall performance of the state's and leverage of the state's technology. About the process, I mean, we've been working and socializing this with our agency partners, both at the management and employee level for over a year now. This has been a long journey. It's candidly, as you point out, has been slowed down by COVID. A lot of these people had to redirect to, like we talked about, enabling teleworking and helping the state adapt to a very new way of working during the pandemic. But, we're definitely regaining momentum there, but we're still in the early days. And so there are no transfers in this budget related to that initiative at this stage. So we're still, in the early days of implementation there. So hopefully that's some helpful background. And as you know, this is one of our favorite topics. So if you want to, anytime you want to set up our time to talk about it, we'll be there.
Absolutely, and I appreciate you've reached out to me and my co-chair on numerous occasions, but it's still very daunting because it's so large. And the other part of it is it's almost like everybody is not included in this evolution. And that's the part that I worry about because, for example, we talked to Department of Housing about getting out the COVID dollars for having all that money to go out, and they don't have an IT system to do it. So we're hindering ourselves by not encompassing everybody in this transition that is being presented. And there are areas that need it desperately so that we help the people of Connecticut. I mean, that is the whole purpose, is to make it easier for us to get services out there. And I guess the agencies that have the most service delivery should be the ones that are in the forefront in doing that. So I hope we'll talk about that when you send us the organizational chart for those areas. So I thank you. And I can't get away from this. I have to say, I am not in favor of doing COVID vaccinations by age. That will be a discussion at another time. I feel that is going to really create more of a void for minorities and low-income families because of that. So I just had to say that. So thank you, sir. We'll talk about that one.
Okay, I would love to talk more about that. I strongly disagree. I mean, I think as we've gone through the implementation plans and the options, this gives us our best chance to address the equity that we're seeing across the country and the disparities in terms of who's getting vaccinated. But it's a much longer discussion. So I'd love to take that offline either later tonight or tomorrow with you, Representative. On your prior point about the Department of Housing, it's actually a great example of why we need to do this. Because housing is included in the centralization, and by bringing them in, you get them more resources to take on brand new programs like the rent relief program that's coming down the pipe, where every state has to stand up a brand new process to distribute hundreds of millions of dollars. And again, this is a great example because Mark Raymond, our CIO, has spent countless hours with the Department of Housing doing vendor demos, helping them do the due diligence around which system should we bring into the state of Connecticut and how should we implement that to get money out to people efficiently as quickly as we can for people who are in so much need, who are going to be the recipients of these funds. So that is exactly an example of the type of teamwork that we're going to be able to build up through this initiative. So thank you for the question.
Thank you, Madam Chair, for indulging me. I didn't talk that much with anybody else today, so I just want to say thank you.
Thank you very much. Next up is Senator Lesser. Representative Walker, who now gets the 3 questions because of your comments. So Senator Lesser, followed by Representative Datham.
Yes, thank you, Madam Chair. And actually, like Representative Walker, I would like in another conversation to hear more information about the age rating thing. I know it's not an appropriations question, but would love to have that conversation elsewhere. 2 things. One, I see in the budget there's a discussion of selling off some properties, some high-profile properties right around the state capitol, and wanted to see if the DAS had some sort of master plan, how if you had an identified buyer, how that was determined was going to be a priority. And second, wanted to know, I had a question about workers' comp payments to see if the state was contesting payments or making payments to workers affected by COVID on the job.
Great, thank you, Senator, for the questions. Good to see you. With regards to the properties, yes, we have vacated 1820 Trinity Street and 30 Trinity Street, which are incredible properties, directly across the street from the Capitol. For anyone who knows downtown Hartford, on Bushnell Park, right there. We've moved those missions into different office buildings between 55 Farmington, some into the newly renovated state office building at 165 Capitol Avenue. So we are in the process. There is a very slow and bureaucratic process to surplus state property, and we are working our way through that. And we hope to list those properties for sale as soon as we possibly can. And then, we will see what the market wants to do. I think there's a lot of people who would love to see housing there. I think there's others who may want to continue commercial applications, but our business will be to list it and facilitate a fair sale for the taxpayers of the state. With regards to your question on workers' comp, I'd actually turn that maybe to Deputy Commissioner Herms or our Division Director for Workers' Comp, Bob Gadita, if they want to take that, please.
Good evening. We have Robert Gadita on here. He is our administrator over the workers' compensation area. He can provide some insight for you, Senator.
Hi, Senator. Robert Jadita. I'm the DAS Workers' Comp HR Administrator. Your question was relevant to, has the state of Connecticut, I believe, denied claims, or is that correct?
Right. Well, are you making payments? Have you contested claims on the basis of whether or not something is work related? I'm just trying to get an update on whether or not the state is effectively giving a presumption to people who were essential workers, particularly during the height of the first wave.
Yes, absolutely. Under the advice of the Attorney General, and we're following the executive order accordingly within the parameters of 7JJJ from March 10th to May 20th of 20. That is a rebuttable presumption, which I believe you are aware of. But we are making payments in accordance to the executive order.
And have you contested payments?
Yes, we have.
Okay. Is there any information you could share with the subcommittee that would be helpful for us to sort of monitor workers' compensation claims pursuant to this?
Absolutely. We release data relevant to the executive order of how many claims have been reported in regards to COVID, which are report only, how many are compensable, how many are related related claims that may be denied, and how many have been paid without prejudice.
Okay, great. If you could share that with the subcommittee, that would be helpful. Thank you very much.
Absolutely. You're welcome.
All set, Senator?
That's it, Madam Chair.
All righty. Representative Datham.
Thank you very much, Madam Chair. And I'm just going to quickly echo my colleague, Representative Walker. I'm also really concerned about the vaccination worry about people that are in denser parts of the state, as well as the medically fragile individuals, and just doing it straight by age, where we might be missing those people. But going back to my appropriations lane, I was wondering if the agency has put together any reports about the consolidation of the human resources function. I'd love to get an understanding of where we think we're going to be receiving cost savings as a result, how our agencies are going to be able to effectively manage the human resources if they're not sat in an agency, and any sort of evaluation you have done to make this decision, and would love to hear also if other states are moving towards this direction, if this is something that's happening. So you can bring that to the working group. You don't necessarily need to answer, because I know we only have a few minutes left. My second question has to do around the Contracting Standards Board, and I would love to have a larger discussion at the working group, how we can help make that work more efficiently and effectively for our state, so that we can manage our contracts, our procurement, and ensuring that we are really on top of how we're spending our taxpayer dollars. Thank you very much, Madam Chair.
Thank you, Representative. Look forward to both of those discussions. Would like to just maybe at a very high level on the human resources centralization. We'll go through all the detail, whatever you'd like to see. At the highest level, the concept is similar in that, rather than have people scattered across each agency who have to try to figure out how to do a little bit of everything, when you can specialize certain highly similar repetitive processes, like how you process leaves and benefits, for example, you can get a lot of expertise and get people more consistent answers more quickly to work through those transactional volumes. And then you can specialize in the other areas as well, and still have the business partners who are on site at the agencies to advise the leadership team, to answer quick questions for people, et cetera. And by doing all of that in a more efficient process, you actually, as we see a lot of retirements coming in this function, as we will in many others, we can make some more targeted replacements and overall be able to do the process more efficiently with higher service. So that's a kind of quick summary of the opportunity there.
And that makes sense. I just want to understand the rationale and where we see that there's going to be cost savings, whether if it's in recruitment, if it's benefit management, or whatever function it is. Also, if it's part of an IT automation, that's another question. So I just really want to understand the strategic document that you've put together on this.
Would love to take you and the group through that. Absolutely. And then with regards to your second question about the Contracting Standards Board, I just would like to remind everyone, we have a very strong procurement department in DAS that does exactly what you just described, led by Carol Wilson, who's led that department for a number of years. Has done an absolutely exceptional job. Unfortunately, is going to be retiring in the not too distant future, but we will, continue to forge ahead with the great work that team has done, delivering very strong and robust procurement practices for the state taxpayers, saving money, diversifying our supplier base and other things. So we've got great processes already in place within DAS in partnership with our agencies.
And maybe just an understanding why maybe that organization, the Contracting Standards Board, isn't working closer with DAS to prove out that we are doing the best job that we can possibly be doing.
Well, Carol and her team, I think, attend all of their meetings. They assist them regularly with inquiries and other items. So my sense is there is good teamwork there, but if there's areas we can improve it, we'd love to talk about that.
Great. Thank you so much, Commissioner, and thank you, Madam Chair.
Thank you. Representative Baker.
Thank you, Mr. Chair. Commissioner, I thank you for highlighting and it looks like you're really doing a lot of good house cleaning and savings. And so a couple questions I have in regards to your savings of, do you, when you do your contracts in terms of with your cleaning and your security, is that exclusively per building, per contract, per cleaning, or is it more of a universal? You have like a company, and you have what, one overall big contract, and it's broken down by buildings? How does that work?
Sure. Maybe I could turn that question to Doug Moore. You want to take that one?
Sure thing, Commissioner. Doug Moore, DAS Facilities. Representative, to answer your question, there's a number of statutes that exist on the books that effectuate how we hire janitorial services in the state. We have to use a standard wage for any contract that's valued over $50,000. We also have to use several programs that exist for disadvantaged workers that have an opportunity to bid on our work. The way we do our contracting for cleaning services is it's a performance based. So we develop a performance specification of how well we want to clean buildings, and then the vendors or the contractors bid on that performance spec and tell us. So they determine the number of workers that will clean a building. We don't. We just want to clean to a certain level. So that's how we do the cleaning contractors. And security contracts are based on man hours. We pay a billable hour. So in the situation with security guards, it's usually we have a post that we need it to be manned for X amount of hours, and that's where we come up for the billing for that.
So you have a so for instance, you might have like maybe 20 different cleaning companies that you have contracts with. And
I
10
don't
different security companies.
I believe the DAS security, DAS as a procurement agency has a security guard contract. I believe there are 3 security firms on there. So we can use any one of those 3. And then the cleaning contracts are bid out on an individual building basis. So potentially any cleaning contractor could bid on a specific building cleaning contract.
Okay, all right, thank you. I do have some other questions, but I'll submit them. Thank you, I appreciate you.
Thank you.
Thank you, Madam Chair.
Thank you, Representative Baker. Representative Nolan.
Good afternoon, Commissioner. Thanks for coming before us and giving us the information that you have been discussing. And I'm trying to understand the vaccines and the age thing. How do we come up? How do we determine it?
Sure. So I'll try to keep this brief. And as mentioned, happy to have a longer discussion. But as we were looking at how other states were implementing this as frontline essential worker and high-risk medical condition guidance that initially had come from the CDC, and then there had been other lists put together, it quickly became about half of the population of the state of Connecticut. And so, and the process to administer it was going to be incredibly complex, thinking about how you define the subcategories in each of those groups and who's in and who's out, and how you're going to ask for proof at the vaccination site. Because if you are, you're going to scare away, potentially undocumented, or, you're going to slow down the process, make it harder on the people doing the vaccines, more paperwork for them. If you don't, then you're going to have potentially line jumpers, and the process, will get out of hand. And so, simplicity and clarity are key for both of our key priorities related to speed and equity. I think we can all hopefully appreciate that when you have really complicated, opaque processes, the people who have time and resources and technology and connections are going to find their way to the front of those lines, and the people who don't are going to get left behind. And so one of the things we heard consistently from our providers and everyone is the more simple and clear you can keep it for people about when they're eligible, it's going to help us achieve our equity goals. And the other thing the governor announced today in the press conference to be a companion to this is a commitment from our large vaccinating partners that they will execute to the high SBI zip codes around the state, those that are most vulnerable to public health pandemics, including this one, that it's not just going to be, we're going to have a lot of vaccine clinics in those zip codes, which we already have. We've already gone to great efforts to allocate the doses into those areas, but making sure that the appointments are also proportional to the people who actually live there. So there's a lot of techniques that the providers are going to take to fulfill that goal, but we're going to have later in this week, some very, direct and public partnerships announced around target setting for equity in those communities and the actions behind them, many of which are already underway in terms of mobile clinics in underserved communities and other actions, but much more to come there because we certainly do have more work to do there.
Okay, but I just don't understand how using age is going to bring about equity, because it just eliminates. I just don't see how age is going to accomplish that.
Sure. Well, it's by itself, it's not. It has to. That will enable a simplified process that makes it easy for people to get an appointment and get in line and not be confused about, am I eligible? Am I not? Am I on some list or not? But it alone is not enough. I completely agree with you about that. It has to be the three legs of the stool, right? Number one is, are we getting enough vaccine available to people who are doing the clinics in these underserved communities? We're taking care of that at the state level. We're making sure that everyone who's doing clinics in those communities has as much vaccine as they can handle for the signups that they're getting. Number two is the actual access on the ground. And this is what I was just talking about. We need to do more mobile clinics. We need to do more, more in terms of saving reservation slots for people who actually live in those communities as well. And a number of other actions that we're working on with our local health departments in our cities and other communities that are behind right now. And then the third place is education and making sure everybody feels comfortable and confident about getting vaccine when it is their turn, it is available to them. So we got to get all three of those things right at the same time to really move the needle on the disparities that we're seeing.
Okay. A little shaken on that one because I just think that I just don't see that as an outlet. Age is an outlet to trying to fix the problem of the disparities. But I do agree with the mobile clinics and more feet on the ground. But when are we going to see the action of all that?
So there's more and more action every day. I mean, we've been working on this nonstop for weeks, but every day there's more. It's community by community with key stakeholders there. We're helping to convene where it's not happening fast enough. We're working with the providers. We're trying to match up, clergy who want to have vaccination clinics associated with their communities and getting them matched up with vaccine partners. It's ongoing on the ground every day. It's not enough. We have to do more. And we welcome your partnership. If you don't feel like you're plugged into that enough yet, we'd love to fix that very quickly. So maybe we could discuss further offline.
And I don't dare ask another question because I see Senator Olson shaking in her chair a little bit. So thank you for that. I'll catch you in the next run.
Thank you, Representative Dolan.
I'm not really shaking in my chair. I'm just trying to figure out. I keep my house at 61 and now I have my outside coat on. So I'm, just trying to figure out how I'm going to stay warm. That's all. Representative McCarty, I'm sorry, Commissioner, we're going a little bit over. Representative McCarty, you have a question?
Yes, thank you, Madam Chair, and I'll be very quick. Welcome, Commissioner. Just in looking through the department's budget, I noticed that there's quite a bit of savings on one of the buildings that is leased over $5 million. Would it be possible for you to give us a sense or percentage of how many buildings the state is leasing compared to how many they own, and just a little perspective on that? What we could maybe possibly expect in savings going forward.
Sure, I'll turn that over to someone else on the team, but just to point out quickly that the large savings in the leased space is largely tied to one building, 55 Elm Street, which was used as the swing space for the renovation of the state office building at 165 Capitol. So that renovation is completed. Those people moved back into 165, and so we were able to terminate that lease last year.
Right. And I was just curious to know if we had any other buildings that we are leasing and look at what the potential in the future would be. But I also want to compliment your department for the LED, for using the lighting, the LED lighting that really showed significant savings. And I'd also be curious as to how many other buildings we might be looking, going out into the future to put in all that efficiency lighting in place. Thank you.
We're all credit to Deputy Commissioner Petra and Doug Moore, who you just saw a moment ago. They're really driving those energy efficiency initiatives forward. And as you noted in the budget, they are not just good for the environment, they actually help us save money. So everybody wins. And we're going to keep working through that. And on your broader point, we're constantly looking at our real estate portfolio, looking at opportunities to consolidate space and optimize our footprint to save money where we can.
Thank you.
Thank you, Representative.
All set, Representative McCarty?
Yes, it's fine. Thank you.
I remind everybody that if you have any additional questions for the commissioner, you can give them to Sue Keen. I have two questions. One, on Trinity, have you looked at perhaps turning that over to the pension fund, which would add to the portfolio and provide some income for the pension fund? Have you done a cost benefit analysis on whether that's a good move or not? What would that do for providing sort of a diversification of income for the pension funds?
So you mean like renting it out?
They would take care of that. Have you looked at giving the Trinity Street properties to the pension funds and let them keep the rents out of that particular building?
Well, there's no rents. Right now, the building's empty.
Correct, correct. But if there were, have you looked at it at all? I would say that no is the answer.
We haven't. We're not, I don't think we typically try to get in the business of being a private landlord. As a state, I think our goal is to shed the properties, sell them, and return those funds to the wherever OPM says they go. We follow their guidance on that stuff.
And how many buildings have you looked at? I see that we shed the buildings up here in Hartford, but have you looked at the buildings relative to the prison system that we've closed, Webster, soon to be JB Gates, some of the other facilities that have closed around the state that still remain under the umbrella of the Department of Correction?
Yeah, maybe, I don't know, Noel or Doug, when you guys, or Shane, you guys want to take that?
Sure, Commissioner. This is Shane Mallory, DAS Real Estate. OPM also controls that process. The agency with care and control has to surplus the property first, and then OPM decides what happens with it. They have not come to DAS for disposition at this point. Any of those corrections properties, they may do so in the future, but as of right now, they're not under DAS's responsibility.
So if you could bring to the working group, again, the listing of the properties that we have, those that are empty and not being used, no matter where they happen to be, under whatever agency they may happen to have, and so that we could see that, that would be great. Are there any other questions for the commissioner? But at least relative to the budget and not relative to COVID. So, everybody has to take advantage of the times they see you, Commissioner. So thank you very much, Commissioner, for coming. I'm sorry we kept you a little bit longer. Apologize for that. DAS is one of the larger budgets, and there's been some significant changes that many people are concerned about. And in order for them to feel comfortable, they're going to ask questions. So we look forward to seeing you at the working group. And I imagine that you'll be one of those agencies that we'll see for at least 2, maybe 3 of the working group sessions to go through the different components of it. So thank you very much.
Thank you, Senator. Thank you to the whole committee. Hopefully next time in person, much better format. And I think we're almost there, and look forward to the working session. So thank you.
Yeah, we all want to get back in person. Madam Administrator, can you give us a lay of the land for tonight?
We are scheduled to begin the public hearing at 6:30 this evening, and we have 23 speakers on our list.
Thank you very much, Madam Administrator. We're going to try to keep it to one or two questions, but limited questions tonight if possible, for clarifying purposes only, and to try to get things moving along. So 23 would give us a little bit over an hour. So we'll see what'll happen. All right. Thank you very much, everybody.